The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Darian's chance to see and Cassandra's bone marrow transplant. Ten-year-old Cassandra has had surgery, chemotherapy, and radiation for germ cell cancer. Now, she must undergo chemotherapy so aggressive, it will destroy her immune system.
Cassandra, you never had this test before?
Yeah, she did once.
Without a bone marrow transplant, even a simple infection could be fatal.
So what we need to do is just get you up in the bed here.
Today, Cassandra is being tested to ensure doctors she is strong enough to withstand the treatment that could save her life. If the bone marrow transplant is not successful, Cassandra may not survive.
So what we're going to be doing is injecting a little bit of a radioactive material into the blood, and we're going to watch it as it goes into the kidneys to see how well the kidneys are functioning.
So this is just to make sure everything's okay before.
Yeah, it just gives them an idea of how well the kidneys are filtering the blood.
This way.
Do you want me to count to 3 when I do it?
Yeah.
1, 2, yeah, the needle's in, and I'm just putting stuff in now, okay? We're going to start the pictures and there's no more pokes after this. Okay, you did a good job, sweetie.
Not so bad. Feel okay now?
My week's growing up.
I know. Do you want to take out?
Might as well be comfortable.
It was falling off. She said, it's coming off.
It's coming up. Okay, so you want me to put the movie on? Okay, great.
That's okay. That's all right.
Okay, we'll take pictures for about 20 minutes.
Cassandra? Okay, so you know what's all about. It's just blowing test, all right? So we can ask Mom to have a seat in the waiting room, all right? There's no needles or anything, all right? Okay. So put them out on. Nose clip on your nose. Now take a big breath in, as big as you can, and blow as long as you can out. Out, 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 out. Go, 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 and in again. Excellent. Very good, Cassandra. Take it off. Relax. Okay.
Okay, we'll start by probably bringing him over to the table.
Darian Gervais Delaney is 5 weeks old and cannot see. He was born with opaque corneas in both eyes.
Is he well today? He's got a stuffy nose. Yeah, he went to the doctor's on Tuesday.
Today, Darian will undergo a corneal transplant in the hope that his vision can be restored.
Was he a full-term baby?
No, he was born 6 days early.
All right, that's within our range of full-term.
Yeah.
Up to 3 weeks before.
You know what, sweetie, I'm gonna have to wake you up a little bit. I don't like to poke him while they're sleeping.
He's not gonna open his eyes anyway.
Okay. No, that's yucky. You having surgery this morning?
Yeah,
What time?
it's supposed to be at 8.
Are you gonna be okay to carry and press on his little thumb?
Yeah.
Okay, Daddy, when you get upstairs, just have the nurse take a look at it, okay? It should be fine, but yeah, just have it, yeah, be careful, there's everything so close. Great.
Are you all set?
Yeah.
Wow, how big was he when I saw him the first time? He's gained a lot of weight. Looks like a big boy now. Okay, do you have any questions you want to ask me beforehand?
Which eye was it you're doing? The right one? You
Usually
said
I'll do the right eye first when
The right
both
eye's
eyes
the
have
one
to
that
be
he
done.
doesn't open all the time.
So as you know, his cornea, which is like the dome on the front of the eye, didn't develop properly. It didn't separate from the other structures, and as a result, he's got a big white spot in the center. And basically what I'm going to do is use a special knife and cut out the center white spot and put in a new one from a donor. But he'll just have the patch for one day. Come back tomorrow morning.
When he gets the patch off tomorrow, are we gonna be able to see his pupil now?
Should be able to, yeah.
So you don't know right away then if the procedure worked or not?
Yeah, initially, yeah. I mean, you know, it's the first step in
You can have a
a
black
long
eye.
process.
So bring him over here now, or?
Nope, just stay here for now. We're just waiting for some blood work. Okay?
Thank you.
Okay.
So for the next week or so, So you'll be getting your chemotherapy and you'll be in your step-down room, which is room 63 that we showed you. On the day of your transplant, we're going to move you into an isolation room, and this is what it looks like. One thing that's different about our floor too, Cassandra, is the visiting policy that we have. If you are to have any visitors, they'll go out to our parent lounge. Okay?
So yeah, they don't come past the doors?
Yeah, they don't come past those first 2 doors. The other thing is that any family members or friends that are visiting that have any sort of cold symptoms or are not feeling well, they really shouldn't come to the unit at all. Today we'll just start on some medications. The last dose of chemotherapy is going to be on Monday.
Okay.
So 2 days after that, she has her transplant.
And then as soon as she gets a transplant, she's in isolation?
Yeah,
Okay.
we move her in the morning of it, and then in the afternoon, she'll get her transplant. So she'll be starting her chemotherapy around noon hour tomorrow.
You guys take them from here then? Yeah.
So you're gonna wait in the waiting room?
I'll come and talk to you after the operation. As soon as it's finished, I'll let you know.
All right.
Take good care of him.
Thanks.
So I'll see you later.
All right.
That white spot, which is where the cornea didn't separate properly from the rest of the eye. I'm going to make a little paracentesis and divide some of these adhesions. There we go. See how everything in a child just wants to come out of the eye as soon as you start. It's important to move quickly because the longer you wait, the more the intraocular contents tend to protrude. Okay, can we get the donor, please?
This is my first bag.
Okay.
It's gonna run over an hour. And we just cover it up because it's light sensitive.
Okay. And she's gonna get gravel in between if she needs it?
And she can have gravel or Ativan.
Maybe Ativan makes her sick. Yeah, made her sick last time.
See us for the first time.
It's gonna look weird though, eh? After they take the patch off, one eye will look different than the other eye. It's not
Weird to
fun.
him. If you can see now. Find out anyways.
Scissors the other way, please. The lens is perfectly clear, which is good. You can see even once you get a couple sutures in, you can start to breathe a little bit easier. We'll just continue to put in more stitches till we have 16. If they're going to reject, they'll reject within the first 6 months. If you get beyond 6 months, then the cornea will usually stay clear at that point. Hi. The colored part of the eye was stuck to the back of the cornea and we were able to peel that off. And the lens itself is clear. There's no cataract there at this point anyhow. Sometimes
So that means that all it was the cornea was just clouded?
mainly, yeah.
Yeah. Okay, can I see him now or I
They'll
wait
come
still?
and get you when he's in the recovery room.
Okay.
And then a month from now, we're going to take out the stitches in the right eye, and we're going to operate on the left eye at that time.
Okay.
And then a month after that, we'll
Will you give
him some
he needs
glasses.
he needs drops and stuff, doesn't
Yeah.
he? But you'll give me that
We'll give you
tomorrow.
all of that stuff tomorrow.
Okay.
Okay,
Okay.
that's great.
Thank you very much.
You're welcome.
Bye.
Are they all off? Yep, they're all off. So we'll heparinize you, and then you can walk down to the new room. Okay, so we'll just have you stand up, Cassie, and I'll cover you with the sheet.
There
Or you can be a ghost for Halloween.
All right, here we go. Great. So all of us are going to wash our hands, if you're okay just standing for a minute, and then we'll get you in the room, Cassie. I will take off your sheet. And this is how we get in. Here you go. You need to be wearing a gown if you're going to be touching Cassie at all.
I was told, yeah, you can't touch, can't kiss her, can't hug her.
Yeah, we avoid close, intimate contact, like face-to-face, so hugging and kissing. If you do touch your face or touch your hair, you should come out and wash your hands again before you would touch Cassie.
Okay.
Yeah.
So I can hold her hand?
Yeah.
Okay.
Yeah, definitely.
Okay.
Yeah. Okay. So we're all set. You might start to feel a little bit sleepy with some of the medications. 3 o'clock, we'll do your reinfusion with your cells.
Why don't you take your jacket off?
Woke up pretty quick, eh?
Tired? I can't touch it.
Okay, here we go. So I have the stem cells here. We're going to go in over 15 to 20 minutes. With the pre-medications, the children usually
Sleep right through it.
Yeah.
So has it started yet? No, eh? Oh, it has?
Started going through.
Oh, it did? Okay. She's anxious. She keeps saying, I wonder how my hair is going to come back this time.
So that's it.
Good.
It's all done.
And everything stayed really good through the whole thing.
Yes. It's a big lead up. It's a big day. So now
for sure,
Now
yeah.
we just have to wait over the next week or two and see how she does.
Okay.
I'll let you sleep, Kay Cass. You're all done. Your temperature is 37.8. I know that you spiked a temperature on the weekend, and a lot of the times we don't always find an exact cause of the fevers. It's something that's probably just inside of you, and it's like an opportunist infection. It takes the opportunity when you don't have any white cells to fight it to jump up.
Well, how long do the monsters last?
They last until your white cells recover as well, actually. Are they starting to bother you?
Yeah, for what?
Anywhere between 14 to 21 days. So what we're looking for are your polys or your neutrophils are going to be greater than 0.5 for 3 days in a row.
So what I'm going to do is take out the stitches and we'll check the other eye as well.
It'll be a lot shorter today.
Yeah, shorter than doing the transplant for sure. But we do a bunch of measurements, so it does take a while.
What we were going to ask you about the glasses, because sometimes the glasses make the eyes worse. Isn't his prescription going to have to get stronger and stronger and stronger?
No, the glasses don't really make the eye worse. They just act as a focusing aid.
You said he'll probably have to have more surgeries as he gets bigger.
He may have to,
He might have to.
depending on how long the transplants work and if he has a rejection, things like that.
Oh, he can still have a rejection, even
yeah.
like within like the next couple of years or whatever.
Okay, and we'll see you in just a little while.
Okay.
Okay, dearie, you ready to go?
Here. Okay, I won't wake you up, okay? You take good care. I'm checking my skirt. Oh. See you, baby. Thank you.
I'm just going to examine the transplant, make sure that it's okay. Cornea was cloudy before. Now it can get a good look inside.
Hi, Cassandra. You know that your count today is 0.5.
Starting to go up.
Yeah, it kind of hiccups at the beginning, you know.
Yeah,
so
go up and down.
we're seeing the beginnings of the marrow starting to take hold and coming back. I wouldn't be disappointed if, for example, tomorrow's count comes back less than 0.5. You aren't getting out of here until the neutrophils are greater than 0.5.
Yeah, just to be sure.
Yeah. Are you going to have a good weekend? You don't know.
Try.
What I'm going to do is go around and take out every second one first. Okay, we're all done. We'll just go and talk to the parents now. Everything looks very good. Both transplants are perfectly clear, and the lenses inside the eye are clear. And I had a good look at the retina as well, which looks quite normal. That's great.
Thank you.
That's my pleasure.
Is he awake yet, do you know?
They took him to recovery room already, so.
Maybe a little bit fussy. We'll see. You know all this.
I know what that. How are you? Feisty guy here.
We just gave him a little tiny nip of some medicine for pain.
The first time he had it done, though, he was so quiet. All he wanted to do was sleep. And then last time, he just screamed. He thought, no more.
I'm sure he's probably hungry too, so all of that comes into play. There.
Hey, Cassie, isn't it great? Your white blood cell count today was 6, and it was 2 yesterday. And your polys are 3.78 today, and they're only 1.12 yesterday. So let's go to your new room, okay?
Okay.
Let's just put that on. Unfortunately, you're stuck with that for a while. You're in room 63 before, right?
Yeah.
Much better, right? Much better. As soon as you leave this doorway, you have to have the mask on your face. Once you step foot back in the room again, you can take it off.
Okay.
Good. Alrighty.
He's really opening up his eyes nicely.
Oh, he follows everything.
That's great. Come on in and take a closer look. See what his eyes look like here.
You guys never see him awake.
Yeah, it's true. He's really awake today. You see the light? Good boy. What's he doing these days in terms of watching things?
He follows everything. If he's eating and I laugh at him, he smiles at me and
That's great.
he pays attention. Like he'll lay in his crib now because his mobile's moving.
I think that the chance of these transplants staying clear is excellent, probably about 90%.
That's good.
But even with glasses, his vision's not going to be 20/20.
It'll be okay though.
It'll be, yeah.
Not bad.
Yeah, it'll be pretty good.
That's good.
All right.
Who's that? Say daddy.
Who's that?
Didn't turn out too thick.
Okay. Oh yeah, that's true, eh? I thought they were gonna be super thick.
Darren. What'd you do?
Now that Darian has recovered from surgery and has his new glasses, he is able to see clearly for the first time. Doctors will continue to monitor Darian for several months, but are optimistic he will develop good vision.
Just have to hold it there. Just leave it, it'll dry.
Hi. Oh, you look so different. I haven't seen you like this before.
Oh no? It's because she's getting out of here.
Basically, all you needed was to get rid of me for a few days. And
And then out of
things will
isolation,
stay
I know.
You know that from the white cell point of view, your white cells are there, but that they're not functioning totally normally right now.
Right.
And they won't for probably the next year or so.
Okay.
We still have to be careful about infection, of course, and that's why you're on a lot of the
medications.
medications.
Yeah.
But otherwise, you know, there's no reason to change any of her normal activities.
Can I go trick-or-treating?
Yeah, I don't see why not. I mean, as long as you
She
have
has the mask
on, and you probably work the mask into your costume, right?
Actually,
I'm gonna be a
she's going
doctor.
as a doctor. Yeah.
So you happy about going home? I bet you are.
Thanks very much.
You're welcome.
Thank you for everything.
Yeah.
Thanks.
Okay, bye.
Bye. Say hope to see you soon, but.
Yeah. No, actually, we don't.
After only 3 weeks in hospital, Cassandra is ready to go home.
Bye. Thank you.
Cassandra.
Cassandra has had a remarkable recovery from bone marrow transplant, and it is hoped she will continue to do well.
Fresh air.
The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Shannon's arthritis and Vishal's transformation. Vishal is 3 years old and was born with a cleft lip and palate. He also has a hole in his heart, which has delayed his physical development. Vishal and his mother have traveled to Toronto from their home in Guyana with support from the hospital's Herbie Fund and the local Guyanese community.
Can you go like this? Are you happy you're here?
Of course. I just want my son to be okay.
You want your son?
Doctors plan to repair Vishal's heart first, then close his lip and palate. Today he will have testing to ensure that he is healthy enough to endure the surgeries.
I want you to be very strong for Vishal, because when he goes through all these appointments, he's going to look to your face to make sure he's okay. Don't be scared. You're in very, very good hands, Shazzy. You're in very good hands.
Basically, why we're interested in looking at your son's teeth is we want to make sure that there's no cavities or no sources of any dental infection, because with teeth that are infected, the infection can track down into the heart and cause bigger problems for your son. And because he already has a heart problem, we don't want to jeopardize his cardiac status. So what we're going to do is take a look at his teeth. He has at least 4 deep cavities in his teeth. As a result of that, they're setting the tooth up for an infection. So you'd want to treat that before any extensive cardiac surgery would take place.
Yeah.
That's very important.
Yeah.
So it's a good thing that you came here to our dental office, because
Yeah.
this is important.
Yeah.
This has to be treated.
Mhm.
Okay?
3-year-old Shannon has been diagnosed with juvenile arthritis. Her joints have become stiff and swollen, making it difficult for her to walk.
Where's the card?
Okay.
Pocket.
Okay. Oh, wow. Okay, you give the nurse.
Today, Shannon will undergo joint injections that doctors hope will restore her mobility and ease her pain.
What do you need to tell the nurse? Huh?
Every time that my knees and everything has been hurting.
And it's still hurting? Yeah. And you're gonna show her which one hurt? Which one? This one hurts? Remember you get stickers the last time?
Candy too?
You want candy?
Yeah.
Yeah? Okay. Candy? Well, after you finished.
I'm Dr. Feldman, Brian Feldman.
Hi, Sharon.
Hello, Marlon.
Pleased to meet you. Do you guys want to have a seat here? We can talk. Has she had injections before?
No, this is our first time.
The first time.
Yeah.
Let me have a look right now. We'll see. Let's look at your knee. Yeah, I can see why they want to put a cast on there because she is a little bit contracted and bent.
Yeah.
She's quite swollen.
Okay.
Does that hurt, sweetie? Maybe a little bit. Now, Dr. Cameron's written down here that she'd like me to inject Shannon's right wrist, both her ankles, and her right knee. Does that sound correct to you?
Yeah.
Shannon's going to come into the procedure room over there and she'll be put to sleep. What we'll do when she's asleep is we'll inject in a medicine that's a very long-lasting form of cortisone called triamcinolone hexacetonide. Okay?
Very long name.
Right, but it's a very long-lasting form of cortisone, essentially. Now, the only potential serious side effect, as you know, we all have germs crawling around our skin all the time. There's germs in the air. And it's theoretically possible that on the tip of our needle, we could take one of those germs and put it inside her joint. And if a germ got inside her joint, it could cause an infection in the joint. It would give her a red, hot, swollen joint. She'd have a fever. She'd be miserable. And if it wasn't treated right away, it could result in permanent damage to the joint.
And I'll be looking after Michelle's teeth today, okay? There are 2 or 3 teeth that we might have to take out. Did you know that? Yes, okay. With the heart problem, it's important that we not leave any infected teeth behind. That can affect the outcome of the heart surgery. All right?
Gonna say bye-bye, Mom? See you soon? That's good. We'll take good care, okay?
Oh, cutie. You're such a good boy. You are such a good boy. This child has a fairly small mouth, and also with the age, it's not a lot of working room. And typically, we put the rubber dam on all the teeth, but this is a physical impossibility in this case.
How did they feed him? He must have had some really special adaptations on his bottle.
I'm sure it was very, very difficult at a young age in making a seal for suckling. I think the mother has done a tremendous job in raising this child with this sort of defect.
Are you going to have to pull those front teeth?
No, they'll be left. They are important structures. They help maintain the bone integrity in the area. And my assumption is they really want this structure to stay in place. I'm going to have to take out these 3 molars. They are beyond restoration.
Soon you're gonna get all ready up.
Oh, you're gonna lose your card.
I have it.
Well, Shannon, let's go see Elmo.
Have her back out to you in about 20 minutes.
Bye.
Be a good girl, okay?
Okay.
Love you.
Love you. Up we go. Oh, okay. She can just hold on to that.
Does she want to sit up or does she want to lie down?
Daddy's going to sit on a chair.
So Shannon, when we finish, we gotta go downstairs for the surprise. Remember you asked me for the surprise? And the freezies? After we finish? She's tired too.
I think she's off to sleep
There you
now.
go. Wonderful.
There.
Thank you.
Okay. Here's going to be the difficult one.
That knuckle.
That's what 6 joints will do, right?
Yes, 6 or 7 more joints.
How much time do you need for the cast?
While they're doing the other joints, I can do them, yeah. You can help me just hold her foot.
You're doing a mold for the cast?
No, actually, we just throw a plaster cast on now for about 48 hours. and it gives them a good stretch and good rest post-injection, and we don't splint nearly as often now.
Let's try. 3 little fingers. So we'll just proceed with removal of that tooth. Forceps on the tooth cleanly. Okay, this is the tooth here.
And if one of you can level off that bed too.
Michelle's in recovery now, and all's well. We did have to remove 3 baby teeth. All 3 were infected. We also repaired the upper left tooth here. You'll see there's a stainless steel crown in place. In the areas where I took out the teeth, I put in some stitches. They will dissolve away in about a week. Do you have any questions?
Like how you remove the teeth, would
Yes.
it bleed? Would the gum bleed?
It's not bleeding now. It might start bleeding a little bit when he has something to eat. Don't be bothered by that. Just some steady pressure with a clean Kleenex on the end of your finger will stop it. All right, good. Okay,
nice
thank you very much.
Thank you
Nice
very
to meet
much.
you. Bye-bye.
There we go. You can put your stuff down on the floor there, Mommy, and then you can hold them, okay? There we go. Oh, okay. Here, Mommy, you can sit right here, actually, okay?
Oh, that's better.
There we go. Nice and cozy. Oh, dear.
Oh, that's a good looking cast.
Yeah, ready to fall off when she comes in.
She had these fingers injected.
Yeah.
Okay. She also had this finger right here injected.
Okay.
And then the rest of it's just tape, because when we had the IV started, we had to take some of the tape off. And we wanted to make sure the IV wasn't going to fall out, because she was getting her medication through that as well to keep her sleeping. So that's why she has so much tape on here.
Yeah.
Okay, you ready?
Get it, get it, get it.
Get them. Oh, you got it. Oh.
Get it, get it.
Oh, you did it. You got it. You take the towel, put it right here. You're going to give it a great big hug. Real big hug. Okay? Now it's your turn. Can you give a big hug? Oh, very good.
Cough now. Cough your mama here. Cough.
We're so close. If you can get him to start playing with the bubbles and trying anything that you can to take deeper breaths. Cheryl, who you met from Child Life, we were thinking about maybe even getting some feathers. And if you put the feathers in your hands, you can try and blow. Oh, you're back! The only thing I'd like to do then is just have a quick listen to his lungs now before, just so we know what they're like. Do you like that? Do you want to listen after? Okay, I'll let you listen.
Now you cough.
Good cough! That was very good. Can you hear it?
So you know that your son has a hole in the heart?
Yeah.
Yeah. On Thursday this week,
Yeah.
he's scheduled for operation, for the closure of the hole in the heart.
Yeah.
And that's a fairly straightforward operation. Nothing is without any risks with, I mean, when you deal with a heart defect that has to be operated on. And there is no such thing as a procedure without any risks of either dying or having a major complication. To kind of guarantee you a fortunate outcome. It'll be, since you will be alone with them, it'll be a little bit tougher for you than maybe for someone else.
Okay. You'll be all better in a couple of days. Don't you want to feel better? Yeah, so you can play, right?
Once she eats, you can certainly take her home.
Yeah.
But you got the cast instructions just to keep this dry. Just touch her toes every once in a while when she's up, just to make sure that they're nice and warm. Okay, and that this isn't too tight. You can have her Tylenol.
Don't squeeze it.
Happy on it.
Okay.
nothing in Chris' bag.
Silly daddies, eh? I bet she must have a very clean bedroom at home.
Oh, yeah. You gonna say bye to the nurse?
Bye.
Bye. See you later. See you Monday. Okay, have a very nice Christmas.
Are you about ready, Dolly June?
Yeah. This will take about 4.5 hours, maybe a bit longer. Okay?
The operation?
Yeah, and Dr. Coles will come and talk to you at the end.
I just want you to take good care of him.
We will.
We'll take very good care of you.
All right? Good boy. Mama will see you later.
All right, Slim. Come. I guess you don't want your PJ top, do you? Ah. Say bye.
Bye-bye.
Say
Bye-bye, fish.
Say bye. You're drunker than a skip. Feel free, Heather.
I'll get the guys.
Scalpel?
Starting?
We're in?
We're just opening the sternum now, so. Yeah. Take your incision right down to there. Let's see how this looks. It's a big heart.
Venous line is open.
It's got a 30%.
It looks like it's ready to come off on its own, sliding down there. Where's it, your feet?
That's Santa
Is that?
signed it.
Oh, wow.
Who signed
So would
it?
you like to keep your cast then when we cut it off? Would you like to take it home?
Good morning. I'm the cast lady. I'm going to take your cast off for you. Have you ever had one off before? It's very noisy, but it doesn't hurt. It won't hurt.
Done. See? Yeah. Now I'm going to pop it off. Good girl.
Now we just spread it. It won't hurt. Doesn't hurt.
Okay.
And you'll be able to save it. That will be good. And you can have your cast and take it home with you.
You're all done.
Good girl.
See? Yeah. Okay, let's have a look. That is great so far.
Oh, yeah.
That's perfect movement.
Yeah.
No
Better
fluid.
than before, yeah.
Perfect movement. And if we certainly move down to her ankles, they are lots better. You remember how puffy they were.
Yeah.
We can start to see some ankle bones again, which is nice. And this is what I'm most happy about because she probably rested lacking a good 30 or 35 degrees of full straightening. And now, if I was to do a quick guess, she would be, you know, about 8 degrees. So that looks much better. Very good.
She's been using the foot a lot now to go up
She actually
the stairs.
alternated nicely coming
Yeah.
up there. I'm surprised she used both sides. So that's nice to see. It's gonna be nice and warm. Are you ready? Very nice. But you can tell it's certainly not sore for her anymore. I mean, she really lets you stretch it very well.
Yeah.
Where's your legs? They're not kicking at all. Come on. Where's your legs?
Wow, big jump.
Very good.
Yeah. Wow.
That's good jumping.
Yes.
We're just trying to visualize the margins of the VSD. It's a little bit of an inaccessible area. So you bring it back up into here. I think I bring it right into there. This is a Dacron patch used to close the VSD. Think this is small? No, I think that's fine. We're just tying the patch in, that's right. Yeah. Make sure that that's tight, the suture is tight. And then we're going to close the aorta.
Looks okay.
Yep. Okay. The heart's beating spontaneously in a normal sinus rhythm, which is one of the things we look for. Quite pleased with the function of the heart. The post-operative assessment on the echocardiogram looked quite good. Great, well, good news. You can relax, everything went fine, and your baby's doing fine now. So I was quite pleased with the way things went. We closed the hole off, and that went quite well. The key thing in the next few hours will be to monitor the function of the heart, make sure there's no bleeding, and things like that. But longer term, we will need to communicate with the physicians in Guyana.
Thank you very
Okay.
much. Thank you.
Good.
Thank you very much.
Okay.
Hiya, good to see you. So what do you think? How do you think she's doing?
She's doing pretty good. I see a lot of improvement in her.
And this is the knee that was out completely before.
Yeah.
The joint injections have done tremendously well. I mean, she looks so much better. But you know, we still have, our goal is to get her as perfect as we can get her.
Well, the medication that she's gonna go on, would she be on it for a long period of time?
For some children, we're talking months. For many children, in all honesty, we're talking years. Only Shannon's response will tell us, meaning already she's improved so dramatically, and that's a very good sign for me. All right.
Thank you very much.
Oh, you're welcome. Very sweet of you.
Now that Shannon has undergone joint injections and physiotherapy, her mobility is restored and she is experiencing less pain. Shannon is once again able to enjoy the active life of a 3-year-old.
Let's go.
That one? Yes.
Okay, looks as if they're finished. You want to come by and then? Okay, so.
Oh, he's done really well. Doctors are really happy with him. Okay. So just put the side down and you can give him up. Okay.
Can I have a look at this dress?
Sure. Do you want to have a look? I just covered it up.
That's okay, just pull this.
So here's just small. Okay, and there's no stitches there. Okay, and these are the pacing wires. Okay, and we put them in all the children.
Thank you so much.
You're welcome. You're welcome. He's done really well. The doctors are really pleased with him.
Vishal now faces a challenging recovery. He will be closely monitored for signs that his heart surgery has been a success. It could be some time before he is strong enough to endure the operation to repair his cleft lip and palate, and he and his mother can return home to Guyana. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Danielle's scoliosis and Vishal's transformation continues. Vishal is 4 years old and was born with a cleft lip and palate and a hole in his heart. He and his mother have traveled to Toronto from their home in Guyana.
Are you happy you're here?
Of course. I just want my son to be okay.
You want your son to be good.
Good boy.
Doctors first focused on Vishal's cardiac condition, and he underwent a 5-hour surgery to patch the hole in his heart.
We're just tying the patch in, that's right. As far as his heart is concerned, though, we're quite pleased and everything seems to be fine.
After 6 months of recovery and preparation to repair his cleft lip and palate, today Vishal will be examined to see if he is ready for surgery.
So you're going to help me as you've been helping me all this while?
What do you
You're
have
gonna
to
give
take
my
out?
hand?
What do you have to take out? What do you have to take out from your mouth? Take it out? Okay. You want to take out your plate? Okay.
take it out?
Yeah.
Thank you. Can I see your teeth first? Okay, good. He's all set for surgery. That's him you remember in June.
Yeah.
That's just after his heart surgery. And in the last 6 months, you've been working very hard, putting all those tapes on every day and applying everything, and that's the result we've got. You've been doing a great job.
Yeah. So, thank you very much.
Good luck for the surgery.
Thanks.
Okay?
You want to give him a hug? Give him a hug.
Okay.
Bye. Okay.
Okay, good luck. All the best.
Thank you very much.
15-year-old Danielle McBride was born with cerebral palsy and over the last 2 years has developed scoliosis, a severe curvature of the spine. Her condition is causing her pain and makes it difficult for her to sit in her wheelchair. Doctors hope that by surgically attaching rods to Danielle's spine, they will be able to straighten her back and relieve her pain so she can resume her normal life.
We're going to test how that message travels from all the way up down your leg, through your spine, back into your head. Think you can relax?
Yeah.
Oh, I think you're already quite relaxed, aren't you? She's wonderful. And you always this good, kiddo?
Yeah.
Really?
With everybody else, right?
Do you feel something in your foot?
Yes.
Yes, keep it still, keep it still, keep it still. Good. Okay. We're all done.
Hi. How are you doing? So here's your x-rays today. You see here you're sitting in your chair. There's your head over here. You can see your braces and your teeth and a couple cavities, right? Some fillings in the back. Some fillings in the back over there. And this is your back. And normally the back is straight up and down line. You can see your back really bends over quite a bit near the bottom here. So it's really bent near the bottom.
So she's sitting totally on her right hip.
So she's sitting really on the one side, yeah.
Yeah.
Okay. The goal of our operation is going to be to make her pelvis level on the top part of her spine. And we put rods that go all the way down into the bottom of the pelvis. We actually use wires in the bones of the spine and actually pull the spine on to where the rod is to hold the pelvic part pretty much straight over the top part of the spine. Okay. And so we'll use bone to fuse it in place. Okay, now
I think she's just tired of being in pain.
Yeah.
Yeah.
One more? One more? One more kiss? Give Mama a hug now. Hug. Ella, I don't like you. Bye. Where are you going?
Okay, so we're all set. So we're going to start at the back, do the palate, and if we can do the front, we will. I hope so. I hope we can do everything. It's a lot to do everything, but I want to see how he does under the anesthetic and make sure that everything is okay. Right?
Michelle, I'm Dr. Kemp. I'm the sleep doctor. And this is my friend Dr. Harrison, and the two of us are going to help you have a rest.
Bye. Bye.
Come on, you need to go for a ride. That's a fella. Come on, let's go. I'm going to show you some pictures on the wall.
Turn the other way.
That's a good boy. Are you getting tired, Michelle? Are you ready to lay down, sweetheart? Let's try and lay you down, honey.
This is a bit of a challenge, don't you think?
Oh, I would say this is about a 10 on the 10 scale.
It's a toughie. Yeah, I'd like to work on the palate first. If everything is all right, then we can go ahead with the lip.
That's a very large palatal defect, though. You can imagine how difficult it is to speak or eat with a cleft in the palate like that. Things would come out through your nose. It would have articulation defects and difficult speaking. So this is really going to change his life in a profound way if we can get this closed up.
We're going to change the location of some of the tissue, some of the muscles, and move them around in the palate and on the lip to simulate the normal situation.
Okay, Danielle was born on March the 3rd, 1985.
Yeah. 500 million.
You haven't had that many.
I know.
7.
I'm proud of it too.
What are you proud of?
Having 7 surgeries.
Oh.
She says she's proud of it.
No.
That's what you said.
I said I'm proud of not having 50,000 million.
Hi Danielle, my name's Dr. Hunter. Ted. So, you've had some surgeries before, right?
Yeah.
Okay, and what do you remember? Now the last surgery you had was when? Last year for your hip?
Yeah.
And what do you remember about that?
I went in and went to sleep.
Okay, was it a bad experience? Was it an okay experience? Was it...
It was pretty bad.
Yeah, what was bad about it? Was there something in particular that was bad about it?
No.
It was scary?
Yeah.
Okay, did they explain to you everything that was going to happen before you went in, Danielle?
Yeah.
What part do you remember that was bad?
Yeah. For you to be scared right here, you know what? I don't meet anybody who's coming and who understands what's going on, who isn't scared, okay? Because you have the toughest job this morning. You're the one who has to be courageous and who has to work with me, all right? We're going to work as a team. Have you worked as a team before with people? Yeah, so we're going to work as a team this morning, okay?
Mm-hmm.
We go through everything together, okay? And are you going to bring anybody in with you? Is Bear coming in with you?
Yeah.
Okay, so Bear's going to come in with you. What's his name?
Pooh Bear.
Was it Pooh Bear? So what do you call him? Pooh?
Yeah.
Okay, all right. So Pooh's going to come in.
Yeah, that looks great.
So that's the palate completed. So the nasal side is done. So what we're going to do today is try to close this cleft lip by utilizing the central portion as the central part of the lip, and then we're going to move in elements from the side in here. So this line will join up with this line. So it's a very wide cleft. It's not going to be easy. It's going to be snug, isn't it?
It's plastic surgery.
Okay. So we hug. And then we'll take good care of you, don't worry, Danielle.
And then we put something around your arm to take your blood pressure, okay? And then once we do that, then we're going to go with the laughing gas. I'm going to tell you to start counting backwards, okay? 5. Then what? 4. There we go.
4 down.
This part of the spine, we're going to expose the back part of the bones. And then after we expose the back part of the bones, we're going to put wires and rods into the spine to get it as straight as possible. Because you have to be very careful not to damage the nerves, because they're right there underneath the bones. Hand now. Okay, great. Okay, now, see if we can get this rod in. Quickly. Take that back.
What do you think? Cut that off and then just be able to
Sew it in. We'll walk in the woods. Our job's done.
No problem. Everything went really very well. We went to sleep nicely. We had no trouble during the anesthetic. We repaired the palate and also the lip. We're going to watch him closely tonight. Because now his palate is closed, so he just doesn't have the same airway in his palate. And so we have to watch his breathing. Make sure he's going to have to breathe with his mouth open, so we have to watch him pretty closely. But he looks great. Looks much different than he did before.
So I will know him?
I think you'll recognize him, but he'll look different.
Okay.
Okay?
Okay.
Good.
Thank you very much.
You're very welcome.
It's waiting that kills you.
Okay, you set? So now we've gotten the rod into the pelvis. We're going to be able to straighten out the spine. We're going to actually push this a bit over here to hold it straight. We're going to start to slowly tighten towards the middle, and you want to work on suctioning out any blood. Even though she doesn't walk, she still has absolutely perfect sensation. And we don't want to do something to damage that. That really could make her life a lot worse. This is the bone graft. This is, again, the bone that we harvested, and this will allow all the bones of the spine to fuse into place. It's a long operation, but it's finally finished. And her spine looks pretty straight, and she should do pretty well for this operation.
You look like we feel.
Everything went absolutely fine. Everything went very smoothly. She's extubated, the breathing tube is out, she's in the recovery room, and she really did fantastic. I think we got an awful lot of correction in her spine. I think she'll be very happy. When you look at her, you're going to be very surprised when you look at her.
Excellent.
Good.
Good.
Okay. So no complications? Everything?
No complications at all.
Good.
She really did super.
So glad. The doctor just came out, so she just went into recovery, and she has to wake up before we're allowed in. But things went well, and he said he got more correction than he expected. Yeah, so it went well. But it's been a long day. Yeah. Yeah. No. She probably won't be till tomorrow.
Hey, how you doing?
Hey, how are you?
She's done amazingly.
How are you? Hey,
She
your
did
finger's
good?
glowing. No, don't worry, these babies. How are you? She'll be breastfeeding after the surgery. Dr. Allman said he got your back straighter than he thought he was going to. Isn't that awesome?
I'm so happy.
Me too.
He said you got a lot more than he thought he'd get.
Yeah. He said we'll be surprised at how you look.
Yeah.
He said we'll be surprised.
Hi, baby. Hi, guys. How are you doing? Hi, Michelle. Hi, sweetie. He's been doing really good. Yeah, he's been drinking.
Excellent.
Actually, he don't want to drink anymore. He want to eat now.
Yeah, he
Well,
can't wait.
I want him to just have fluids today.
Yeah.
And tomorrow we can move him up to something more soft kinds of foods. And he's drinking okay. He looks great.
Yeah.
The swelling's going down. He's breathing okay. So it won't be long before you'll be able to get out of here.
Good job. He's doing amazing. Okay.
Are you okay?
I don't know. I think I'm all right.
Alrighty.
Okay,
Put your
slow,
bum right back.
slow. Well, yeah. 1 second. Okay, just so we get you situated. Up a bit more, Mom.
Okay, just a second. We'll get underarms now. Up, under
Too
your arm.
much. This is too much.
Okay, we'll put a cushion behind you. There you go.
This is too much.
Hold on a second.
No.
Just moving your legs up. And remember, Dr. Allman said it's going to feel different because you're not used to sitting on that one hip. Just usually use the left or the right. Left
I
hand.
know it's not fair, babe. I know it's not.
Right here.
Hello. Is your eye feeling a little puffy over here? Is your eye okay?
Yeah, it is.
Yeah, when did that start?
I don't know.
It's been swollen the whole time.
Sometimes the eyes get a little swollen because during the surgery, you know, your head is down very low, but the swelling around your eye will go away. Okay?
Okay.
Yeah. How are you feeling otherwise?
Good.
You're sitting a little more comfortable?
Yeah.
I suspect maybe by Sunday, but probably by Monday you may even want to go home.
Okay.
Yeah.
Those fingers crossed.
Yeah, you should be able to be.
Yay.
Yay. Okay.
Hi. How are you? Come on into my office and we'll have a look, all right? How you doing? Okay. Let's have a look at you. Oh, looks wonderful.
He's eating more, playing more,
Put my glasses
getting more bad.
More bad? He can't be bad. Are you getting bad? Are you getting bad? No. Can you hold him so I can have a look at his palate? And you can put his head down. Absolutely perfect. I'm very happy. It's all healed up fine. Well, long trip for you.
Yeah.
Very long journey. Now
It's for the better.
Now coming to an end.
Yeah.
And you can get home and get on with your life.
Oh yeah.
He's going to start exploring the world that he never could explore before.
Oh yeah, that's true.
It's a new world for you, buddy. Okay, he's fine. Big hug?
Big hug?
Oh, bye.
After 10 months in Toronto, Vishal and his mother can now return home to Guyana. He will continue to be monitored, and it is hopeful that Vishal will continue to thrive.
Having any problems at all?
My hip.
Your hip is hurting you.
Okay.
Sorry.
Okay.
And it just, when she's on her back, you'll see it looks like she's really wind sweeping this
Yeah,
way.
that's from her. Yeah, it's really just move. It's how about moving it?
Move it.
Yeah, it's just. How about moving it this way? Is this also
Oh,
better?
no.
Okay, I won't move it anymore.
It was all right at first, but I think the more we started moving her, and then the more she started complaining about it.
Her pelvis is in a very, very different position, and her hip is really being moved around from a place hasn't been in for a while. That's really what's causing the problem.
So will this go away?
Yeah, I think
It's not something she's going to have to live with?
It's not something she's gonna have to live with. That I can tell you.
Okay.
Good.
Hold on.
Oh, God.
No, it's Jim. Go.
1, 2, 3.
Ow.
Yep.
Done.
Long day.
Is your back giving you any trouble?
No.
It's helped her head control. She
Great.
used to be like this.
Right.
And now she's eating. She used to be really messy, and now...
I don't make mess.
You don't make a mess. Good job.
Yeah.
Are you happy you got the operation?
Yeah.
Okay. See you later.
Okay, thank you.
Okay, bye-bye.
Now that Danielle has undergone scoliosis surgery, her spine is straight.
Bye-bye.
Although she is still experiencing discomfort in her hip, doctors hope that the pain will soon subside. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Janine's new ear. "15-year-old Janine Dunton was born with a syndrome that resulted in many health problems, including hearing impairment. She also does not have a left ear. Today, Janine will meet a team of doctors to prepare for surgery to fit her with a prosthetic ear.
Hey, sport. It's new and exciting.
The surgery offers cosmetic and social benefits and is very important to Janine now that she is in high school.
How's school? Is this better than going to school, coming here today?
Yeah.
Yeah. And after this visit, you know, it's a very stressful visit, so I don't want you cleaning your room for a couple of weeks. So, this is it. Let me just see which ear we're looking at. This one here. Does it bug you? Not having one doesn't bug you at all, but you'd like one, eh?
Yeah.
In the old days, they didn't have anything we could do for this except sort of stick on ears. But now we have the ability to put on ears that stick right on, and they can't come off. So they can be pulled off, but only with a little bit of force. And they really look absolutely beautiful. And the only thing that will feel unnatural is if anybody ever nibbles on your earlobe, you won't feel it because it's made of plastic. But apart from that, it'll look good, and you really will be hard-pressed to see that it's not your real ear. So this is an operation that we do just to sort of improve the quality of life. We think it's one of the most important things you can do for a child and a young growing teenage woman is just make sure that they are comfortable as they can be in their skin. And it'll be a beauty. It'll be a beauty. I have the template, so I'll show you that. And then that will guide and show me exactly where the best place to put the two retaining fixtures is. And then hopefully tomorrow we'll have enough depth of bone to be able to put the fixtures in, plus attach the abutments, plus thin the skin.
And how long does the entire process take if you can do everything?
The operation? A couple hours. Tomorrow's the opera. You know any songs you play in the opera? How do I? Okay, so David, sweetheart, go ahead and have you two there. Are you comfortable? Okay. David, there's a concern here about recreating the hairline.
Actually, the hairline tends to get in the way of creating a good interface with the prosthetic margin.
Right. Okay, honey, I'm just going to write on you. Right, and that's far enough in front for you. Yeah. All right. If you think I'm going to remember any of that, you can just forget it. So that's good. All right.
Have you always had hearing loss? She's missing an ear on this side. Mild to moderate loss on this side.
Okay.
Like normal hearing with the hearing aid in.
They'll tell you downstairs when they want to take the hearing aid off. They might take it off right in the operating room, and then they'll save it for you.
Yeah, I don't think you're going to be able to wear it in there, Janine.
But then I'll walk in it.
They'll let you know.
But then what?
I'll walk in it back on.
Well, we don't know that for sure. She's just concerned that she might not be able, after the operation, might not be able to put it back in.
She wouldn't be able to hear.
She wouldn't be able to hear anything if she didn't have it.
Okay. You can have a seat.
Well, hopefully it's you, Dr. Paxson, and I'll ask him. Janine? The hearing aid. You want to leave it on.
Well, I want it in.
When you wake up.
Yeah.
What did I miss here?
She wants to keep her hearing aid in.
Will you want to take it out for the operation?
When she's asleep. You know, because we'll want to communicate with her and tell her what we're doing until she's asleep. And then when she's asleep, we'll take it out and turn it off. And as soon as she's awake again, we'll put it back in.
You have to do the skin graft. Where do you take it from?
High up on the thigh. That's a medical term for the bottom. All right, we're all set. And the nurse will take you in, and then we'll get started, and I'll come see you when I'm done.
We'll see you in a couple hours, eh? For the kiss?
See you when you wake up, Dad.
Oops, I'm gonna go to the button.
Okay. Bye, sweetie.
Go. We're gonna give it to Mom?
Is that what we're gonna do, or are you gonna hold on to it? What was the deal?
What was the deal that you...
I think she wanted you to hold it. And
Okay, then I'm gonna put it in my pocket.
Okay, so let's position now, and let's get on with the show. We'll just put this on, and then we'll just shave a bit of the area. I try and shave as little as you can, because these girls hate being shaved, you know. Try and preserve her sideburns, so she hides the post-op scar. Like that, and like that. And we go like that.
Yeah.
And like that. So that's good. Now we're just gonna, that is actually, we almost did it perfectly actually. Maybe we'll just take it, this will be our skin graft. They want a centimeter sort of around each pedestal. There's no bone there. Where he wants it, there's no bone. So I'll do the best I can. But I can't put it where he wants it because there's no bone there. That's probably a bone right there.
Yeah, there's one.
You have to just, change things. The portion behind the ear will be thicker than optimal, but still acceptable. Everybody happy?
Yes, I am.
That's all that matters. Okay, here we go, boys and girls. We've been getting away with it pretty well, blood loss free here. Yeah. That's a beauty too. It's nice, it's firm, it's 4 millimeters. Those are 2 half-inch holes. We're gonna go ahead and try the whole thing, and then we'll lay the graft in and put the abutments through and send her upstairs. David, I'm gonna see how you do on your skin graft before I decide how much to undermine here. You really got to take a big skin graft out so that she gets a good healing area, because that's really what makes her happy again, is if she never ever has to come to the operating room again for this. And then when Ann gets back, we can get the abutments.
So are you convinced that the abutment's complete?
Yes. Okay, now for putting on the dressing, can we put her on her back if possible? I want to get the other ear exposed because she was concerned about that.
Where we turn her, so we'll all end up on the floor. Oh,
Okay? Yeah, it's done.
Thanks. Oh, good job.
Thanks.
Okay. Done and perfect.
Good.
Good deal. That actually went really well.
Oh, did it?
I shouldn't sound surprised, but I was expecting that the bleeding would be a bit of a problem, but it wasn't at all. First, we put the template on and we found where they'd marked. And where they marked, there really wasn't sufficient bone. So we went back and farther. Having done that, we found 2 really, really good pieces of bone. And we put a nice skin graft on. So right now there's 2 little buttons coming out.
So there's like no more operations?
No, I'm done.
Good.
Oh, good.
As soon as she wakes up, we can go in and see her, put the hearing aid in, and she'll be fine.
It's really important for her to hear.
I know. So that's why we did it a different way.
Did you just get a shot?
Yeah. Hello.
Hi, B.
How you doing? You all right?
Did you have a nice nap? Can you hear us? The doctor said everything went good, eh? They did everything they wanted to do today. So you're all done.
You're all done. Janine, you're all done.
Days. All right, kiddo, anything hurting? Anything bothering you at all? Excellent. Should I get it off? There's nothing much to it. I'm just going to take this off, and the dressing underneath is what we'll leave you with for a week. And you're not to get it wet. I don't want you doing any skydiving or trampolining. Okay? And
Go to school, probably.
do you want to go to school?
No.
Well, she should really stay home. The fixtures are under there. That's just some polysporin soaked gauze. This is a good hairstyle for a week.
And this is all just some gel and stuff like that. There's a small plastic that'll retain this dressing and allow us to push the skin right close to the skin graft. And that's it, really. So what we'll do now is we'll just sort of put a 4x4 on and just tape that in place just to cover that. And next week I'll see it.
Okay. Thank you.
Come on, let's take a peek. We got all the toys. Did you have a good week?
Yeah.
All right, hop up. Watch your head. I slept through a neurosurgery lecture, so if you knock yourself out, I'm out of luck. All right, Ma, Pa, any problems?
I don't think so.
Okay, buddy, tell me if there's anything that hurts. How's school?
Okay.
Yeah.
Bit of bleeding. She said a couple days at school down by the skin graft.
Yeah. It's not unusual. The whole thing is just looking great. The only part that I had any concerns about was that exposed lower part, and it looks perfect. So everything else is just perfect, perfect, perfect. That whole deep area there will fill in with soft tissue. It always does. And almost too much. I wish I could stop it from filling it. It's perfect today. The skin color will go back to normal. It'll lose that purplish hue. And that's really the end of the show. You won't believe this in a month. You won't believe that it looks like this.
Can you tell us approximately when she
Would have an ear on?
Yes.
I haven't a clue.
Okay.
Honestly, because I think once they start until they're done, if everything goes really smoothly, it's a couple of months.
Okay.
We tend to go really slowly, generally, because if there's any hiccups, we'd rather wait and make sure that they're gone before we proceed, because it's a really expensive thing. And if we rush in, for example, put the ear on before the soft tissue has finished and it's still swollen, the thing doesn't fit 3 weeks later. It's just a complete nightmare. Because then you got a big gap and you're faced with, okay, now do we buy another ear already? So that's why I just completely am so vague about it. I said, it'll be on. It'll definitely be on before college.
Narrows it down.
Pretty much. It'll be soon, honey. It'll be soon. Okay, well, let's have a look.
Come in here. Sure. Yeah. Very welcome. Sorry, I gotta roll over.
Okay, well, let's have a look. I'm going to tip you back here a bit, okay?
Oh, it's pretty good. Yeah, it healed fairly quickly. That's great.
I don't see anything that is going to interfere with the implants at all. Just to outline where we're going to want to make the impression. I'll take it all the way back here, even though. Do you want to watch what I'm doing?
Okay.
All right, I'll give you a mirror and you can watch. See what I'm doing. This is the beginning of the impression. I'm just going to put the impression material lightly against your skin, and it's going to record the shape of the skin. Okay, you have a look at it and I'll go out, make sure we're still square.
Looks fine. Yeah.
Looks good. It's beginning to firm up now too, so. Just going to undo the screws. And then we'll just gradually start to slip these apart. You're probably going to feel I'm pulling your hair a little bit, but I will try and do it as gently as I can. Oh, one hair there. There you go. Good. And there we are. There's our impression. So all those little details, all the contours are the thing that we need, and the ear will adapt to those contours. Okay. You're done, kiddo. Okay? Good.
Okay, Janine, last time you were here, we took impressions of you. Do you remember?
Aye.
Okay, so what we did from that point, this would be the impression that we took the last time, do you remember? Yeah. So there we go. There's an ear. This is your good ear. Alright. And from that, we also took another impression to match your good ear in wax.
Okay.
Right. Okay. So we're going to try this on you. We're going to see how it looks. Now don't be surprised if it's not exactly where you'd like it. See, have a look and we can make all these little changes. Push, there we go. Now, you have a look in the mirror and tell me what you think.
I don't know.
Take your time, son. If there's something a little bit. But feel free, Janine. This is what David does. He wants your
Well, this
input.
one seems a bit big. I don't know.
Seems a little big. Okay. You still like me to make it a bit smaller for you? But Janine, you'll be the final judge. Alright. So I'll try this on you. Snip, snap. There we go.
Yeah.
You like that? Okay, Mum and Dad, what do you think? Yours is equally as important voice.
But it definitely is a little more refined and tipped back here, and I like that. Hey, Robin? There's not as much of a cup to it there at that point.
Yeah, that looks good.
Yeah.
I can't find much wrong with it.
Okay.
I think it's great. Ain't you, Janine?
So what we're going to do next is we're going to mix some colour, and then we'll have another look again with fresh eyes at the wax up. Alright, so we're approaching Journey's End. Not there yet, but the end is in sight. There is light at the end of the tunnel.
Hi, Jenny.
Hi.
All set?
Ready for the big game.
Great, yeah.
Final big push.
Great.
Okay, well, this is it. So, did you remember? Earring
Yeah.
and sunglasses. Okay?
Yeah.
Alright. The most painless piercing you'll ever have. There we go. Ta-da! All you need to do, Janine, is get yourself some Vaseline. Just wipe it on the leading edge, because that's what it does. It makes it all nice and translucent. Okay, ready? Click. Click.
Amazing, eh?
Alright. Now you can have a look in the mirror.
Looks nice, Janine.
Yeah.
Did you ever think this day would come, Janine?
Not really. I don't know.
Do you like the earring where it is?
I think so.
You do? I mean, then you'll be able to wear 2 earrings, but you can even pierce it at the top if you like. But,
What do you think, Mom?
Oh, I think it's beautiful. I thought so much about the day she was born, and they told me. It was devastating.
Journey's End.
It's absolutely amazing.
All right, Dave. Thanks very much.
You're more than welcome.
Good job.
Thank you so much. Oh, take care. Excellent. Thank you so much.
You're gonna put some Vaseline on it, Janine, first? Okay, well, let me hold your hair. Oh, those are nice earrings.
Yeah.
Yeah, very nice. Who gave you those?
Juliana.
Juliana. Yeah, they look good.
Oh, that looks good.
Okay, Janine, you have a good day.
See
I
you,
love
Sam.
you.
Call us.
Yeah, give me a
There's any
call,
problem.
okay? Bye-bye. Bye.
Now that Janine has recovered from surgery and received her prosthetic ear, she is ready to start a new term of high school. One more of the challenges Janine was born with has been overcome. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Natalie's heart operation and Sarah's double vision. Two-year-old Natalie was born with a malformed heart. Instead of 2 functioning pumping chambers, her heart only has 1, leaving her at risk of massive heart failure.
And her fingers are purple and toes are purple.
Natalie must undergo high-risk surgery to repair her heart. 2 previous surgeries have created scarring, and Natalie's heart may be stuck to the wall of her chest. Reopening Natalie's chest could result in fatal bleeding, but without the surgery, Natalie will not survive.
Done. Yeah.
Okay.
Go now. Okay.
Oh, smash it. It's okay. Yeah. Okay, then just hold it first.
Almost done, baby. Almost done.
All done, boo?
Nice and tight, yeah?
I'm done now.
All done now. You are done now.
Mommy,
there's something that's for her.
That's the worst part of your day, then.
1 year ago, 14-year-old Sarah Rampersad underwent massive brain surgery to treat devastating epilepsy. Doctors implanted over 100 electrodes into Sarah's brain to isolate areas causing epileptic seizures. Once the area was located, doctors removed that part of her brain. The surgery eliminated Sarah's seizures, but left her with double vision. Now, 1 year later, Sarah returns to the hospital in the hope that doctors can correct her vision.
Okay, and your chin goes on here, and your nose just barely touches there. Catch the dots that I point to, okay? Like this one. Good job, that's it. So now you can see Dr. Bunzik, right?
How's the double vision coming along?
Fine.
Is it still bothering you?
Sometimes.
Is the double vision mainly horizontal or is it lopsided a bit?
Well, your tie is here. I'll see your tie over there.
Is it sort of even or is it one
Yeah,
tie higher?
Like that.
Certainly with surgery we could make the eyes straighter, there's no doubt about that. But the actual fine-tuning has to be done by her brain in a sense to make the eyes work together.
I would prefer to have eye muscle surgery to get my eyes back better.
Okay.
Is it a long process or is it an in and out?
The surgery? Well, compared to what she had previously done, it's a very straightforward, simple process. The muscles are attached to the white of the eye on the outside of the eye, and we simply open the eye, turn it, and operate on the muscle. And it requires certain stitches that melt on their own after a month or so.
What do you mean by stitching?
My stitches are really, really tiny. Nothing's done on the skin of your eye, around your eye at all, on your lids.
Inside.
Where does these stitches go?
The stitches are in the corner of the white of your eye. Right in the
Okay.
very corner, that's right.
Oh, okay.
Good question. Point of the operation. To take your eye from pointing to the side to the middle. And when your eyes are in the middle together, then your double vision will be changed a great deal. Hopefully it'll be gone, but I can't guarantee that it'll be gone. You might require some prisms to help you, or even possibly a further operation.
Natalie, how are you? Were you examining patients with your stethoscope?
She was.
Has she been well?
Yes.
Any illnesses, infections? Or...
She's been pretty good the last month.
All kinds of incisions, haven't you?
You tell me does good work.
She heals up very well. I think she's ready for the next stage of her treatment. This is a bigger step than the last one and a little bit more difficult on her. As you know, the previous surgery, the last operation, diverted the blood from the upper half of her body, diverting it into the lungs so it didn't go through the heart. Now the final step is to divert the blood from the lower half of her body into the same circuit. In effect, that all of the blood coming back from her body would not go to her heart, it would go directly into her lungs. The main risk that's different in repeat operations is that the heart tends to be stuck to the chest wall. It makes it more difficult and somewhat more hazardous to get control of her circulation.
And this is the best time?
Yes, there's not much to be gained in waiting longer. The operation's not going to get any easier or safer. And we start to lose things by her being blue for as long as she is. And so I think it is the right time.
All right then. It's gonna work, right?
I think it will. And I wish I could tell you not to worry about a thing, but you know, having been through this before, there's lots to worry about.
Grab her at her elbows, okay? So stand right in front of her. Yeah, and hold nice and tight at the elbows. It keeps her nice and straight, and it keeps her head up as well. Okay. So you keep looking right at Mom, so come right in front of her. Good girl. Stretch. I'm just gonna help you move this for a minute. There we go. That's okay. Good. Yep. We're all set. Are you ready? Still like a statue. Look right at Mommy. I'm just gonna make you giggle. Oh, good. You're so good. You're very brave.
Ready to go home?
Yeah.
Who's at home?
Daddy.
So are we all ready for the operation today? Yeah. Okay. I just want to review a little bit with you. As you know, the eyes are pointing outward, and the aim of the operation is to make them straight. Yeah. After reviewing it with my staff, I think the better thing to do is to do one muscle here and one muscle here to allow the eyes to come inward like that. We would just be doing one here and one here. Okay. Okay. So we'll see you later. Okay.
Thanks.
Thank you. Bye-bye.
All right.
I thought it was just this one.
No, that's what you just said. You changed. It's both sides, both ends. Yeah, bilateral, which means both.
Yeah.
Okay. Unfortunately, I'm going to have to interrupt your game here because we're ready to go.
All right then, Sarah.
You breathe, okay?
Bye, mijita.
Everything will be good.
See you later.
Yeah. Okay.
Chantel, I'm your nurse this morning, okay? You don't remember me because last time I saw you, you were a baby. You're a big girl now, right? Okay, I was a little bit big, eh?
Yeah. Maybe swimming in this one.
I'm lupus.
Okay.
Yep.
It's brown. It's supposed to taste like chocolatey cherries or something like that. It doesn't.
No.
Kids don't like it. But
it helps.
It does help. It helps make them a little bit more relaxed and sleepy. And
all right then.
I think that's it.
She's an adult, so you want this.
How come that laughing gases make you laugh?
Well, you haven't had a good crack at it.
You're just laughing already.
You know what we'll do if you like. Good girl. Okay.
Could I have the table up a bit, please? So we'll start with the left eye first, okay? Now, the left eye is the one in which we're going to not worry about the lid. It's just a question of the lateral rectus resection. So here we go. Eugene, would you be able to hold this, please? Thanks. Scissors and forceps. And there, we've hooked the muscle now. Not a problem, okay? That isolates the muscle tendon. So there's a well-isolated lateral rectus muscle. Let's just look at the very tip where it attaches to the globe. There we go. Okay, good. Okay, we're all set to cut the muscle from the globe now. I'm just going to go a little bit above that. I don't want to spread the muscle too much because it's not that wide. Take out the lid speculum, and we'll put this in here. Muscle hook, please.
How are you?
She's very happy at the moment.
Yes, she had the little chocolate drink.
Daddy gonna carry you, okay, babe?
Oh my God. Oh, you are so heavy. Oh. All right.
We'll come to the door.
Okay.
Give mommy a kiss.
Give mommy a kiss.
Hey, baby. I love you.
All right. All right.
Look after her.
You will. All right. See you later, Mom. See you later,
Dr. Williams has allowed 6.5 hours for the procedure, so I'm afraid it's a long wait for you today. I'm sorry.
Power cut. Turn it up to 25. Please. Wire cut again? Go to the depth gauge to tell you where the other side of the sternum is.
Sarah might be happy she don't wear a patch after. So then she'll be seen online.
I hope she doesn't have to wear glasses with prisms.
That's what you were saying.
Everything's proceeding quite nicely here. We're just finishing recessing or weakening the pull of the right lateral rectus muscle on the side of the eyeball. You can see where the tissue has been entered and then brought up, and this will heal quite nicely. There we are. Excellent. Okay. Everything went very well, and what you're going to see when you see her eyes, you'll see some swelling and redness in the corner here and here, 2 on the right eye and 1 on the left eye.
Okay.
And right now we put some antibiotic cream in her eyes, so her eyes may be a little gooey.
Yeah.
Her eyes will be red. She may not be pleased about their appearance, and that's important.
Yes.
She'll be glad she doesn't have to wear a patch.
Yes,
no
Yeah,
patch.
she's happy about that. Yeah,
Yeah, no
yes.
patch for allergies.
Well, once it rushes over.
What we've done so far is just dissect through the previous scar tissue from the other 2 operations. But we're now in the situation where we can put our tubes in and start the actual repair. So we now have a tube in the artery coming out of the heart. And that's what we use to bring blood back from the pump. You could put us on now, please.
Okay.
Going on, your venous line is open.
A5. So the white material is Gore-Tex. It's a synthetic polyurethane that is going to baffle the flow from the lower half of the body through this chamber of the heart without it pausing until it gets into the lung artery. You can see the baffle starting to take shape now that we've got the back wall filled in. 4 millimeter, please.
Thanks.
Sarah, your parents are here.
You can see me?
We just gave her a little bit of pain medication, so she'll stay here till 12:15 with us, okay? Other than that, she's doing really good. She says her eyes are a little blurry, but that's normal. That'll start to improve.
And you have beautiful eyes.
I see.
See it straight now, right?
Yeah.
Right. No double?
No double. I'm looking at you too.
No double vision anymore?
No.
Good.
Usually I look to the side. No.
How many times did you look at your watch?
I can't even tell you. I'm gonna take my watch off because I can't stop looking at it. Looking at the door, looking at my watch, looking at the door.
You could rewarm the patient.
Yep. Coming off?
The heart-lung machine is off now. So the child's maintaining her own blood pressure. We're just in the process of closing the incision, and then she'll go back to the intensive care unit. At the moment, her blood pressures are good, rhythm is fine, so we're happy with progress at the moment.
Hello, Dr. Williams.
And thank you for coming.
Hello. Hi.
Her heart function at the moment's good. Her oxygen level's quite good.
Like what?
So, 95 or so.
Wow.
Is that?
Oh, that's terrific.
So you'll be able to see her shortly. She'll be in the intensive care unit. And it'll take about an hour to settle her, but the next day or two will be critical time. She'll need a lot of care during the first 48 hours particularly.
So far, so good.
So far, so good, exactly.
How's that double vision coming along?
It's closer.
It's closer? A lot closer? Or a little bit closer?
Your ears are touching.
My ears are touching. Okay. Okay. Just look way over here. See what the healing's like. The healing takes a while. The redness takes a while to go away. Look way up high. That's good. And here. I was really hopeful when you woke up and you said you had no double vision. That was great.
I know, my mom said that too.
That's right.
There, she didn't have the double vision.
Right. I think there's a little more work here to be done. Her eyes have re-diverged a little bit. They've both, gone a little wall-eyed, but I think that we can improve this, but I need to let the healing come on. Okay, are you able to tolerate the double vision for 2 months? Does it bother you a lot? What do? Simply ignore the image, the second image?
Just look at the main object.
You could cover the eye if it's confusing to you, or we could give you a pair of glasses with a prism in them. You prefer not that? Okay, but I think she's coping quite well with this. And we probably will have to do something a little more to get you better, and I think we can get you better.
Like
So I
what?
wouldn't give up hope. Pardon me?
Like what?
Like a little more surgery on your eye muscles.
Oh, okay.
And what do you think of that?
Are you disappointed?
No, I'd rather have more surgery than wear prisms. Those thick ass glasses. Those thick ass glasses, I don't want to wear those.
Although Sarah's double vision has been improved, she is willing to face another surgery.
No.
She is more determined than ever to get the best results possible and overcome one of the last consequences of her struggle with epilepsy.
I'm okay.
Hold up all right?
Your fingers are a lot pinker.
Yeah, they're not perfect yet because your circulation is a little sluggish, but they'll be better.
So,
How's she doing if you took that out?
took the breathing tube out?
Yeah.
She's not ready for us to take the breathing tube out.
Okay.
The ventilator's doing all the breathing for her.
Doctors must continue to closely monitor Natalie's low blood pressure. She must remain sedated and on a breathing tube until her condition stabilizes. The next 48 hours are critical for Natalie's survival. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Bubba faces cancer, and Natalie's recovery continues. Two-year-old Natalie was born with a malformed heart, leaving her with low oxygen levels and at risk of massive heart failure.
Okay, well done.
Yeah, go now.
I think she's ready for the next stage of her treatment.
Natalie underwent a 6-hour surgery to repair her heart.
You could rewarm the patient.
As a result of the surgery, fluid has built up in Natalie's chest. It could compress her lungs and once again jeopardize her heart function.
How's that? Yeah. Do you want your bear? Which bear would you like?
This one.
This one, okay. Does he have a nice heart? Does he have a nice heart? Do you have a nice heart? Oh, you do now. Okay, enough sitting. Do you want to lay down again? Okay, go back to sleep.
8-year-old Costa Baba Lambakis has cancer. After 2 surgeries to remove tumors from his pelvis, the cancer has recurred. Now Baba faces another high-risk surgery that may be his only chance for survival.
Get your room now, because then you can't eat after that.
You don't eat no king boy.
His colon must be removed along with the tumor, and Baba must undergo a colostomy. Doctors will create an opening in Baba's abdomen so waste from his bowel can be drained into a bag outside of his body.
To the hip bone.
So I guess it probably was.
So it's probably in about,
Right.
and you don't want to get it too low.
Yeah.
Right there.
Right there?
Mhm.
What does that feel like? Is that comfortable?
Mhm.
Yeah. It's just, I think, a little over more than it was before, but pretty much the same spot, I think.
So we take our trusty little pen here, okay? And go like that. Is that tickle? Okay. And then we're gonna go like here and like here. And we're gonna go, yoo. We make our little happy face. Okay. Do you think that would be a good spot to put it?
Mm-hmm.
Didn't you tell me you wanted it on your head yesterday? Right? You said you wanted it on your head so you could show everybody when you take off your hat?
Yeah.
On the side
Good place for it.
Right on the side of your
That's
head.
cute. Now you become one of my family, you know.
Mm.
Yes, I take care of all the kids in the whole hospital who have ostomies. I'll be following you all the time in the hospital and when you come back for visits. All right.
Well, you can't find us.
Oh, I'll find you.
I like this one.
Is that new apple juice or orange juice, Natalie? You wanted orange juice or apple juice?
I gave her pineapple juice.
Pineapple, yummy. May I listen to your breathing?
No.
No, how come? Are you itchy?
No.
Is it okay if I just listen to how your heart sounds?
Yeah.
Thank you. We listen here?
Mhm.
Thanks. Can you blow bubbles? No bubbles today? Come on.
What was that?
One more, thank you. Okay, that's fine. That's fine. Basically, the criteria is that her chest tubes need to slow down in the drainage until we get about ½ an ounce a day out of each chest tube. And when we get to that level, then the chest tubes can come out. So all we're waiting for is the tubes to slow down. Great. See you later, Natalie.
Take me out. I'm coming off me. I'm coming off me.
Yeah, you bet.
My clothes on now.
Yeah, we'll put your clothes on.
I heard the whole band with 2 IVs. Oh,
Okay.
good
Hold on to the
girl.
arms.
Good.
Just
We're
let her
gonna
get
go
her
to the
feet.
playroom now, okay?
Okay.
Good, Kate. Mommy, Daddy, help you. Just slow Natalie. steps. Look at you. Good girl. Way to go. What a brave girl.
How's that?
Take a break. What's that? What did she say? I can't. You did so good. You did good.
Costa certainly has been through quite a bit with this tumor. And we really do want to make this the final thing. We really want to make sure. I mean, we thought we had it out earlier. And that's why I want to preface things, and that's why we would really err on the side of taking out too much, if you would, than have err on the side of taking too little out.
The last scan, did it shrink even more?
It's exactly the same. So that suggests either it's tumor that's stable, or it may be significantly all scar tissue.
Can you tell from the scan how alive it is, or you just...
That's the hard thing, you can't tell. So that's why you err on the side of taking it out. And you want a clean margin all the way around the tumor. Certainly trying to spare any of that musculature, I think, would put him at risk for things coming back. So our vote would be to take out everything that's left in the pelvis. And then on the left side, where the lesion is maybe stuck to the bone, take off some of the bone there as well. Because there'll be some degree of unknown until you actually go in there and we see how stuck it is to the bone. So before we leave the operating room, we have to be confident that what we've taken out is everything.
This is your big question to ask.
What's the question?
Well, he's very nervous about
the going to sleep part. Now,
I understand.
is there any way possible I can sit in the room, go
Yes.
in the room with them?
Yes.
Is there?
Yes.
Okay. Oh, good. Thank you.
Yes, I will talk to the anesthetist myself.
Okay.
And,
'Cause that's
and we can get. I don't know if he's. I'm sure he's had the.
I find even the
Does it help
the
at all?
things to give him ahead of time to relax agitate him even
It'll make
more.
it worse. So
Yeah,
the
they
easiest
make
of
it
just
worse.
you're the best.
Yeah.
So mom can come in. I'm sure that won't be a problem. I'll talk to the anesthetist. Yeah.
So we've always looked at quality of life. I mean, we're fortunate to have him as long as we've had him, and we're optimistic that he'll be around for a long time.
Oh, you're so good. One more, and this is the yummy one. Here. No? What would you like? Do you want to go for a walk? Okay, let's go for a walk.
Take this and we'll go for a walk.
See, that one's yummy. Okay.
Oh, stickers gotta come off?
Brave girl. Should I take it off? It'll come off. Okay, one more. Okay, remember the French fries. All done.
All done.
All right. Arms up a little bit.
Okay, just hold our hands.
Yeah, that's great.
Let's do this. You smiling at the titty?
Excellent. That's it. You're all done.
All done.
You're all done. You can get her shirt back on. Okay, you put the stickers back on. 1, 2, 3. Oh, get your hair out of there. Over there. Okay. Okay, ready to go for a walk again? Say bye-bye.
All finished? I'm over here, Nick.
Where is she?
Are you all finished? Yeah.
Stomach still hurt? Stomach? No? Just got the jitters?
Any questions, Costa? No? I go over the consent with you. So, Costa lumbacus, excision of pelvic tumor, colostomy, possible pelvic bone resection. Okay. We'll take the right amount of time. If it goes really quickly, great. If it takes longer, this takes longer. It'll probably be a good hour and a half before you even start the procedure. And we'll see you at the end of the day, okay?
You worried? Yeah. You know we're gonna be here, eh, when everything's all over?
You can be a big brave girl?
No.
No? I think you will be.
The chest x-ray that she had on Monday is fine. It shows that there still is a little bit of fluid on the right side, but the tube is in the proper place. It's draining everything, so that the x-ray was fine. We'll do another x-ray after we take the tube out, so once the drainage slows down just a little bit more
To
from
like
where
what?
it is. Oh, probably less than 20 cc's in a day.
Oh, so we have a ways to go.
Yeah, but hopefully by Sunday, Monday. You know,
That's what I was
there's
hoping
light
this
at
week.
the end of the tunnel. Well, that's what we hope for. You know, and sometimes it goes down faster than others. You want those stitches in your tummy taken out?
It's no pokes.
Okay, no poking, okay?
Just a little tickle. Feel a
Okay.
little tickle? No, no needles. No needles.
There's no needles here, sweetheart. Almost. Okay, there's two. Almost. There's two. One more. That was hard work. Okay? Now we're gonna go like this and pat it better.
And then I'm going.
Bend it on. All done.
There.
Okay,
Good
finished.
job. Yay. Yay.
Finished.
Bubba, do you have any questions at all? No? You sure?
Yeah, and you're happy to go down without any medication just as long as Mom comes with you?
Yeah, I'll be with her.
Okay, that's
I'll be
fine.
with you.
Because if you're, we can give him medication here so that he's almost asleep. I mean,
Yeah, well,
really.
I think they did that, and it made him dizzy or stay like this.
Okay, your call. We're just waiting for nursing to be completely
Yeah,
ready, and then
okay.
we'll get you changed.
And okay, good.
Thank you.
Costa? I'm Lainey. One of the nurses that's going to look after you when we bring you in, okay?
It's okay, Barbara. There's going to be lots of us in the room who's going to look after you.
See you when it's all over?
Daisy? Yeah, Mama's right there.
after we get the bladder and small bowel out of the way, he's got a great deal of scar tissue in his pelvis from his previous surgery. Then we can really assess the tumor and get Dr. Allman in here to see whether or not we're going to have to take out part of his pelvic bone or not. And lastly, the biggest concern, of course, is leaving tumor behind, not doing a complete excision. We have the most of the small bowel now up out of the way.
All right, so we have a plan. I guess the challenge is going to be to define the anatomy, define what are the normal structures, what are the abnormal structures, and where is the extent of this mass, because the last thing we want is to injure any of the structures we want to preserve.
Okay, can I put the red toe on?
No.
Just for a second?
I'll take this off.
For 1 second? Oh. You know what, sweetie? I'm just gonna keep this for just a couple of seconds, and then I'm gonna take the red toe off, okay?
Okay.
Okay. Let's see what your numbers are here. Oh, look at that. Awesome. So her drain.
Monkey.
It's come down a lot. Like minimal amounts today. It only drained 7 cc's in the last 8 hours.
Excellent.
Good job. Hopefully we can get that out soon, eh?
You know what to do. You'll be able to talk to him, and if he wants to talk, then you can talk and play with him. If he wants to remain just quiet, okay, I just want you to play with your game and just leave him alone until he's ready. Okay.
Well, the muscle that's attached to the bone is affected, but we can't remove the muscle without taking part of the bone off.
It should be okay. We should be able to go right under there.
Pop right through here.
Take it all,
Right
take
through
it all
here,
from one
and then-
part. We won't take the whole pubic ramus. We'll just take half at the top of it.
We've been able to stay away from the major nerves and vessels so far. So they're all actually been safely isolated and are away from the tumor, so that's good. Great. Yep.
So we've got great exposure. You can see exactly what's going on. So this is what you see. The tumor is here. There's the tumor. See what I'm holding with my hand?
Yeah. That's great.
And this is all the tumor that is infiltrating outside the rectal wall here.
Oh, right, because
I didn't realize we were so close to it.
there's the ligament there.
So what we do is to put the main chest tube out.
You were gonna go for a walk as soon as you're done.
Exactly.
You wanna count to 3? Oh, it's okay. Well, okay, you're being a really brave girl. Yeah, you're a really brave girl.
That's it.
Good girl, all done. Oh, we didn't count to 3. That's okay.
That's it.
Well done. Didn't count to 3, but that's okay.
Oh, we forgot to count.
Never mind, it was better.
I don't think she
All
noticed.
Want to sit up? There. All done.
How's that feel?
Good girl.
Christian, why'd you cry?
Let's take all the garbage away. We don't need all this stuff here. That's it. Take all that out of the way.
Good girl. Does that feel better?
So everything is out.
Yay.
Okay? Oh, brave girl. And see you next week in clinic.
You are. Where are we going?
That way.
And then where?
That way.
Should wait out.
Came out very nicely. It came out complete and very nicely. I think we have a nice resection margin all around. But
So the tumor was near the edge of the bone. It was really hard to tell where the tumor ended and the normal tissues began next to the bone. So we took a little sliver of the bone out from the inside part of the pelvis. So we didn't take the whole bone out. We just took a little sliver.
Now, will that cause? I guess that'll be. Is that quite a painful?
In itself would cause a little bit of pain, but with everything else, the other stuff would be much more painful than just taking the piece of the bone off.
we've sent it all off to pathology as one block, and they're going to look at it.
do the colostomy, okay? Suck her up. This is the end of the colon, which is in continuity with the rest of his bowel. That will be used to form his colostomy. This is going to fold down onto the skin, so it sits up a little bit above the skin. This is going to be a permanent colostomy. So everything went fine.
Yeah, okay.
He did really well. It's just a long surgery.
Yeah.
And his face will be real puffy and so forth.
Okay.
But the breathing tube's out. He's breathing fine in his own.
Okay, so is he going to be in recovery?
Yeah, he'll be in the recovery
Will he
room.
go over to critical care? Or
I think he's going to be okay. I think he'll be able to go up to the floor.
Yeah. Okay.
So again, that's the heart silhouette here. That's the lungs. The picture in the beginning of February shows a little bit more accumulation of fluid in the lungs, especially on the right side. Heart size is the same in shape. Looks fine. So the diuretics work. Here was maybe a little bit of effusion on the right side, which we don't see at the actual picture anymore.
Okay,
They looks really fine. The chest film. It's a nice clear chest film. Excellent.
Sounds great.
Good work.
Good work. Yeah, that was not bad. Thank you. That was not a problem today. Okay.
That's a long way up, eh, Natalie? Okay, go. Oh, thanks too.
Whoa,
Just start and finish line, Stella.
Whoa, you turn mine.
Natalie is fully recovered from her surgery.
Oh, down.
Her heart function and oxygen levels have been improved, and doctors are optimistic that Natalie will continue to be healthy.
Put your little bear to bed.
Yeah, I read.
The end.
And then.
You like that one?
Yeah.
Okay.
Bubba now faces a painful and challenging recovery from surgery. In the meantime, his parents will have to wait for pathology results before they will know if the surgery has been a success. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Tyler's corneal transplant and Bubba's struggle with cancer continues. Eight-year-old Costa Bubba Lambakis has cancer. After 2 surgeries to remove tumors from his pelvis, the cancer recurred.
Our vote would be to take out everything that's left in the pelvis. We would really err on the side of taking out too much than err on the side of taking too little out.
Mom's coming in, don't worry. She's just coming in right
Baba underwent a 10-hour surgery to remove the tumor along with his colon.
There's a tumor.
While Baba heals from surgery, his parents must wait for pathology results before they will know if the tumor has been entirely removed and the operation has been a success.
Is it your tummy that's sore? Yeah.
I want to go back down.
Want to go back down? You don't want to sit anymore? You can't sit anymore? Okay. What happens if you hang your feet a little bit? It hurts more? Okay.
I want to lie down.
You want to lie down? Yeah. Sing again. 1, 2. Okay. Did really, really, really good. That was tough, wasn't it? Strong, silent type. That's it. Keeps it all.
How was the night?
It's the one open, right?
Yeah?
I came to see him every hour on the hour.
Oh, good for you. Well, you probably didn't get much sleep then, eh?
No.
Has he been reasonably comfortable?
The only concern he's had is he tells me that his bladder's full and it hurts.
It was basically picked up and moved out of the way, and then it was also one area was opened up and closed up, so he may have some that sensation of stimulation of his bladder just from all the manipulation and the fact that it was opened and closed again. I think his bowels won't take that long to work, but it'll probably be at least another day or two before he can start anything.
Okay.
He's entitled to be very uncomfortable.
2 years ago, 9-year-old Tyler developed a rare fungal infection which destroyed the cornea in his left eye. 2 previous attempts to transplant a healthy cornea have resulted in rejection. His eye is clouded, and he can only see light and shadows.
When did the corneal transplant? 98?
He's had 2 of them since 98.
Today, Tyler will undergo a 3rd transplant in the hope that the appearance of his eye can be returned to normal and his vision can be restored.
Any rashes? No.
No.
I haven't had one for how long?
Good.
I don't know if you've ever had one.
Well, sometimes, you know, when you
Maybe
go
diaper
outside, you
rash.
get mosquito bites and stuff like that.
Oh, he has a mosquito bite.
Well, millions of them. What's that say?
It says your name. You show mommy your name button to make sure it's you. Okay, here's your chart. Thank you.
You guys got any video games here?
We do. You can play the Mario game over there.
Doesn't even look like
Cares? At least they have these things to keep his mind off of it, though. Because I'm sure he remembers what it's like afterwards.
How's he doing these days?
He's a little nervous, but he hides it very well.
So, you know, he's had a couple transplants and they haven't worked terribly well because of the circumstances that we did the transplants in. The eye was terribly inflamed.
Yeah.
So I think we got a better chance this time of keeping a nice clear transplant.
We're thinking he probably has a better chance because he hasn't had surgery in over a year.
Yeah. And I think the
So the
eye's
eye's pretty settled.
Yeah.
What's next if this is not successful? What's down the road for him?
Well, I think that we could always try another transplant again afterwards, but there's not a lot of good options afterwards at this point in time. You know, he's had 3 transplants and none of them work.
Well, what I would like to do, if this doesn't work, give him a rest. Give him a contact lens so he has, peace of mind at school and leave rest alone.
Is he getting teased at school because of the
Difficult time at school.
Yeah.
Very difficult time. So I think this is why he was so excited to try this one more time. And he's aware that it's quite possible it's not going to take.
What about your tummy? Is it achy, crampy a little bit? Yeah? Okay.
Why don't you give that a little push, okay, before we start? Did you want to do that? Good. Let's see what's going on. No, it's not going to.
Ow. Ow. What are you doing?
You're just trying to get the stitch, okay?
Keep it on. Ow.
I'm sorry.
It done?
Not yet. Okay, the stitches are all out, okay? So now we just have
What's
to
it gonna feel like?
You're gonna feel a pressure in your belly, okay? What my partner's gonna do is just hold your belly nice and tight, okay? And I'm just gonna pull it out as quickly as I can. Ready?
Deep breath in.
Deep breath in and blow it out. Okay, one more. That's
All done,
it.
sweetheart.
All done. It's out. I'm just gonna put a little piece of gauze and tape over top of it, okay?
Okay, just do it.
Really?
Oh, he will be.
No, my dear, we're all finished. Perfect. There, you did a great job. Now your last one too.
You scratch on the back of your hand to go to sleep.
A scratch?
Yeah, but that's the dreaded N word.
That's a needle?
That's a needle. Or we can give you the mask to breathe to go to sleep. We have a new way of doing it though, where it means that you just take one really big deep breath. Do you think you could do that for me? Yeah. All right, then we'll do that. Oh, last goal. All right.
Bye-bye.
Okay, good luck. You'll do good.
Are you going in the wagon or are you walking? It's hardly far enough to bother with. He's so cool, it doesn't matter.
Where is it?
Right around the corner, right here. Let's go. Shall we count down? Would that be a good thing? 5, 4, 3, 2, 1. Breathe out for me. Breathe out. Breathe in. Big deep breath in.
Hold on.
Okay.
Tyler, do you want to hold my hand?
All right. So how about this will be our last go round of this. We'll do the countdown again and then we'll just do it. All right. Are you ready? I know you can do this. I know it's not the nicest thing in the world. But you know what? It's not the worst thing in the world either. And you'll cope because you're a star. All right. 5,
4, 3, 2, 1.
All right. Big deep breath for me. Big deep breath and hold your breath.
Very good.
Hold your breath for me.
Excellent.
All right. And you can breathe away for me if you want. That's fantastic. What an absolute star. Very well done, hey? That's absolutely excellent. Well done. Big deep breath for me.
Hi, Costa.
Hi.
This is Mercedes.
Almost
as big as Brittany. They're gone.
Look at that dog doing kisses. Did you know that Mercedes can do magic? If you put your hand down and I put this little treat on your hand, she'll make it disappear. Do you want to do that? Can you say abracadabra?
And I'll try to
Okay.
magic.
Now, are you ready? Say abracadabra.
Abracadabra.
There we go.
There. Oh, that's great. Hey, you do a great job.
Thank you.
You do a great job.
Did you like that visit, Papa? This is a pretty good day.
Is this gonna hurt?
No, it's not gonna hurt. You're just gonna feel it in your throat a little bit. Okay. Take a deep breath. Good, 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 good. There you go. Good job. Great. You did great. All gone. The tube's gone, okay?
Tyler had this scratch on his cornea, resulted in the cornea turning white, much whiter than it is even now. I had to do a corneal transplant on an emergency basis to preserve the eye. It's hard to find his pupil because it's been drawn downwards. What I'm trying to do is just create a central opening. It's kind of like sewing wet Kleenex together. Tyler's pretty discouraged, and so is the mother. And if we can get the corneal transplant to work, he'll see better, and plus cosmetically he'll be better off.
Mom, when are you gonna do our walk?
We're just getting ready. You want to just check to make sure everything's okay? You can just hold on to my hand right here. Let's let Amanda get out first, okay? You guys can't even catch up to you going so fast. Yeah. You know what
It even looks like the sun might be out. You want to go have a look outside for a minute?
Feeling okay? Yeah, you don't feel dizzy?
You want to keep going for the walk? Yeah? Okay.
And you have to be very careful when you do this because the lens is right underneath, and if you damage the lens, you then get a cataract. Okay, can I have the donor now, please? Thanks. Put some marks on the donor. That's just a matter of lining up the marks. Okay, we're all done. Looks really good. So what I did was took off the scarred cornea and then made a new pupil to give him a more natural looking circle in the center. The cornea was really nice and clear and got it all sewn in nicely. So
now,
provided he doesn't have too much reaction like last time.
So you think everything went pretty good?
Yeah, it went really well. Okay.
Thank you very much.
You're welcome. We'll see you later.
He was a little more lively last time.
Probably because of the other drug they gave him this time.
You gotta eat, Bubba. Get those muscles up.
Hello. No, Costa. How are things?
Good.
So was there fluid coming out of his perineal incision?
Yeah, it was dripping. Yeah.
And when did it stop?
Actually, as soon as I catheterized, like immediately, it did stop. It stopped. What are you doing, Bubba?
He's lost interest in things.
As soon as I did this catheter, it stopped.
Okay. So my suspicion is it leaked from the SP tube site. Usually the bladder is stuck. We had to mobilize it entirely out of the pelvis.
Yeah.
So I suspect it leaked. So we may get a little X-ray study before, just to make sure it's sealed.
Sealed up.
I don't want him draining urine through his incision anymore.
Yeah, okay.
I don't have any final pathology yet.
Okay.
The part with had the bone in it,
Yeah.
they have to decalcify, and that takes
Okay.
upwards over a week, and it's still not done yet.
Okay.
And it's very important to have a final.
Okay, I'm going to try and show you a big letter at the end of the room. Just look with your right eye first so you know where it is.
Right over there.
Okay, now if I cover up the right eye, can you make it out?
Pardon me?
Can you make out the letter now with the left eye?
E?
Open up your eye. Okay. Can you see it? Or not really? You see my hand moving though, right?
Yeah.
How many fingers am I holding here?
2.
Good. Okay. Good. Can you look down a bit? That's great. It looks terrific, really. I'm very, very pleased. Looks much better than the last time. If you remember the last time he had a lot of reaction to the transplant with a lot of cells and inflammation. This time the graft is like perfectly clear.
When did you get the stitches out?
Oh, not for a few months.
Okay, thanks.
Thank you.
All right, Tyler.
Hello.
I'm a lettuce head.
You are a lettuce head.
Look at you. He made his own taco.
Yeah.
This is the joke.
It sounds like he's getting bored with this.
He's wearing it and not eating it.
Mm-hmm. Does anyone actually go into your stomach? Some? Can we have a quick look at your tummy? That looks wonderful. And that's working good. And no more tummy pains, Costa? No? Good. All right. The pathology is still pending. I'll go by this afternoon and bother him again.
Okay.
And we'll stop the antibiotics today.
Yeah. Sounds good.
And if everything is okay with the cathing overnight and no fevers, home tomorrow.
Tomorrow, right?
Eager to go home? Good. All right, we'll see you later. Okay, bye-bye.
Bye.
Do I got an infection?
1:30 in the afternoon.
No.
Thank you. Bye-bye.
Then I'd be able to see.
The last time he had seen you, and a couple days after that, it started to look even cloudier.
What's happened is that because he'd had previous transplants, his body was sensitized to the cornea, and that's why he rejected so early. Usually we don't see rejection this early after surgery. So we just keep our fingers crossed. I hope that by continuing with the steroid drops, the transplant will continue to clear. From the appearance point of view, it definitely looks better, so at least we're winning in that regard.
Put your head up.
Mom.
Roll your eye.
I can use alcohol.
Pardon me?
I can use alcohol.
No, I'm not, because it'll probably sting if I use alcohol.
It won't.
It won't? Do you want me to use alcohol?
Just use alcohol to get off the tape.
The tape in there? Okay, we'll do it your way. Is that easier?
Mm-hmm.
Yeah?
Yep.
That's it. Free man.
Good.
Bye, Costas.
Bye.
Thank you. You okay then? Yep. No. Yeah, you're okay. All right. I can pick up the... Well, you look good compared to when I saw you a week ago. You look great.
It's incredible how he bounced back.
I mean, yeah.
It's nice to be home, right?
Yeah.
The reason that we didn't come back to you immediately with the results of the pathology from the biopsies was because we were having a little difficulty getting a good interpretation of what was there. So the vast majority of tissue that was taken out shows zero evidence of tumor. Okay, so what we think, Costa, is that when they did the surgery, they took everything out that could develop into another tumor. All right, so you basically have nothing in there that looks like cancer at all. The other good part about that is we then have decided not to give you any more chemotherapy. All right, Costa, so that's it. And we're just gonna do the MRI scan every 3 months or so for a little while. But your job now is to try to eat as much as you can and put on some weight.
Mm-hmm.
Okay, Costa, we'll see you in a month.
Thanks very much.
Bye. You're welcome.
You're welcome.
Do you see anything? Do you see my hand moving here?
Mm-hmm.
Yeah? Can you tell how many fingers I'm holding?
2.
Right. How about now? Pardon?
None.
None?
1, 2.
Okay. Actually settled down a little bit. It doesn't look quite as cloudy. Now, in terms of the prosthesis, do you still want to go that route of getting an artificial colored shell put over top of the eye?
Nope.
You just want to leave it the way it is, eh? Okay.
Well, I think he's a lot more comfortable with the actual outcome and the looks of it this time.
Yeah.
The other transplants he's had done, when they failed, they've looked a lot worse.
Yeah, that's true.
And this one definitely looks a lot better than it has. We're going to leave well enough alone. Thank you very much.
Although his corneal transplant has not been successful, Tyler's vision has been improved, and he feels comfortable with the appearance of his eye. Tyler must take precautions to protect his eyes, but he is determined that nothing will stop him from enjoying his normal, energetic life.
No scooter accidents?
No.
Good.
And I put on some weight.
Did you put on, how much weight did you put on?
Like 8 pounds.
8
or something.
pounds?
Like 4 pounds.
They're putting lead shot in your shoes. 4 pounds. Well, can we have a look?
I don't feel anything because of the colostomy. You might have,
You think it feels numb from the colostomy, eh? Can you feel it over this side, though?
Yeah.
Yeah, that's right. Because sometimes the nerves, they start in your back and they wrap around, and the colostomy is blocking some of them. Problems with the incision.
No.
And the last thing, how's his activity at home?
Oh, it's...
Great.
Good?
Video games.
Video games? No, but more than that, I guess the scootering is going well, right?
Video games.
And the video games are going well?
I can't scoot at home.
You can't scooter at home. But he certainly can scoot her.
And just to look at him, he's
remarkable.
Yeah.
Bubba continues to recover his strength after surgery. While he will be closely monitored for a recurrence of the cancer, doctors are hopeful that Bubba will continue to do well. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. On this episode of Life's Little Miracles, Susan arrives from China, and Shannon's struggle with cerebral palsy. Two-year-old Susan Zhu is an orphan. She lives in an orphanage in Guilin City in southern China. Susan was born with a hole in her heart and a narrowed artery leading to her lungs, leaving her with dangerously low oxygen levels. Accompanied by volunteers from the Christian Broadcast Network, Susan has traveled to Toronto, where doctors at the Hospital for Sick Children hope to perform open heart surgery that could save her life.
We just have
That's her, right?
Yeah,
Just to confirm?
We have legal guardian.
Okay, legal guardian.
She's an orphan.
Hi, darling. Let me just confirm that's her birthday. May the 1st, 98. Yes?
So, as I explained, the malformation we named tetralogy of Fallot, and that consists of a hole in the heart, in the ventricular septum, and an obstruction of the blood flow to the lungs. And what we have to do is wants to close the hole in the heart and to enlarge the pathway to the lungs. There are certain risks for this kind of procedure. You could be bleeding after the surgery, and bleeding would mean in a very rare occasion that we have to look a second time into the chest in order to find probably a bleeding spot.
不是，就胸腔那个出水，不管是哪个出水，它可能还会打开，找个出水点，然后再记住。就是出血。对，出水。
15-year-old Shannon Carr has severe cerebral palsy. Her muscles are stiff and spastic, which limit her verbal abilities and make even simple movements painful and difficult.
Shannon Carr. Is that you? Is that you? Yes? Yes.
Doctors hope the drug baclofen will relax Shannon's muscles if it can be injected directly into her spinal fluid. Today, Shannon begins a series of test injections through a catheter that has been inserted into her spine.
How will you be able to tell if it works?
If testing goes well, a pump will be surgically implanted into Shannon to deliver continuous medication, and the quality of her life could be significantly improved.
Shannon has cerebral palsy, and as many children with cerebral palsy, she's got a lot of spasticity in virtually all her muscles, but worse in some than others. And she's been tried on the drug baclofen, which relaxes the muscles and acts on the nervous system, but when you give it into the stomach, its major side effect is sedation. The idea with putting it into the spinal fluid is that you get a very high concentration just around the spinal cord where you want it to act. But we don't know that for sure it'll work, so that's why we're doing the test dose. So we've put half of the catheter in that we'll eventually use, but we're giving her 3 test doses.
Okay.
And that should tell us whether or not it's going to help.
Okay. So Dad's going to hold your hand, okay?
He's going to hold your hand, and we're just going to...
Nothing's hurting.
Nothing's going to hurt, sweetie. We're just going to find your little injection port here, okay?
See there. Look.
There we go.
It's okay.
No, I don't think it allows you to withdraw. Nothing to worry about. This isn't going to hurt at all, sweetie. Shannon, it's okay, sweetie.
Just look at your band-aid.
Just look at your band-aid.
That's good. That's it. We're done.
There, all done. See?
Thank you.
Like you're going to feel very relaxed in about 20 minutes, okay?
You did good.
Over you go. There you go. Okay.
Now,
There.
pillow, that pillow, Liam, that one. That one for your head. Say.
Lots of kisses, huh?
Okay, Mama, you know what? Sit back, and we're gonna put this seat back. That's perfect. Okay, up to your face.
Okay, Peanut, we're gonna take a look.
Okay, baby.
I know, I know.
It's
Oh,
okay.
sweetie.
It's okay.
Yeah. You hold my hand. You hold my hand. Okay, Peanut. Here we go. Sweetie pie.
Oh, good girl. Oh, excellent job.
Okay, so almost done. Almost done. Okay. Mama.
Lots of pressure. Okay, don't be afraid to press, okay?
Yeah. Okay, so yeah. You want? Yeah.
Oh, Mama.
Well, how's she doing?
She's a bit agitated for the first half hour after the, she was, crying a little bit, and she's been pretty dozy ever since she got.
Okay. Look at your legs, okay there, Shannon? That's a girl.
There you go.
That's a girl. There we go. That's a girl. Let me just feel your legs, okay? That's a girl.
That one's probably
That
still
one's
a little
not.
bit.
Yeah,
Not quite.
it is. It's not quite as relaxed as
Not
the one.
quite as
well, I still think we'll give her another test injection.
She still could get sick, right, from
Yeah,
this a
because
bit?
that's what happened last night, right?
Yes.
She vomited later,
About
so
an
let's
hour
just,
after.
yeah, maybe a little bit more. We'll just see how she tolerates this one.
And she had some medication upstairs.
Okay.
It's just to make her drowsy.
Yeah, she did.
Yeah?
Yeah.
Look at those. What are you making? Tea? Are you making tea? All right. Okay. Do you want to give her a hug
Yes.
before we go?
Okay.
Let's go for a walk.
Okay.
Okay, here.
You ready for an APK?
That's a girl, Sharon. Let's just see. So she's responded as we would predict, and
Right.
the drug wears off, she goes back to the way she was. So that's
Right.
all the signs that she should do very well with the pump.
When you put the pump in, it won't affect, like when she's sitting, her ribs or anything?
No, we'll try and place it midway between her rib cage and her hip bone
when
here,
she's
so she
sitting.
sits. It shouldn't.
Okay, will it be as painful for her? Will that one be a little painful?
It might be a little bit more painful
Then
the
what?
first day or so, but
She'll get the backup in as soon as the pump goes in.
yeah, we'll fill the pump, but we're going to start her off in a fairly low dose because we're just giving her one shot here and then it wears off and the pump will continue to infuse it.
Okay.
That's the atrium we're opening, and that's our window to the heart.
is the patch we're putting in to close the hole. Normal pulmonary valves have 3 leaflets. In this case, there are only 2, which is usually what happens with tetralogy. And we just have to see whether or not we can rehabilitate this valve some to make it work for her, which would be ideal.
Dad, are you coming in again? I will, yeah, if you don't mind. Right,
He's a little under the weather. Does it matter? As
Well,
long as he's
depends.
covered up.
Yeah, as long as he's not going to, you know, you're going to be okay yourself. Yeah, right. Yeah, that's all right. Great. Okay. Like it? He's sick looking,
Hi.
It's all over now, Shane. It's almost over. Okay?
I think I'm going to use just some pericardium. Did you open this? No. Mosquito.
Okay.
One?
Thanks, Karen.
Hello. Everything seems to be okay, and the heart seems to be working well.
心脏功能非常好。
We closed the hole in the heart, and then we worked on the pulmonary valve to make it bigger, and also the pulmonary artery on the left side was a little bit small, so we made that a bit bigger as well. She's asleep now. We'll wake her up in a few hours and take the breathing tube out in a few hours.
一共身上得有几个管子？
How many tubes does she have now?
Lots of tubes.
Will there be like special care that we need to do for her?
Well, she'll be in the intensive care unit
Yeah.
for 1 or 2 days, and she
Okay.
goes to the floor,
Uh-huh.
and there it's just a matter of controlling her pain and getting her to where she can eat.
Good. Thank you very much.
You're welcome.
Thank you
You're
very
welcome.
much. Yeah,
We'll
thank
see you.
you. You should touch her hands. Just make some hot, okay? You can touch her. She's got this JPN, and that's draining some blood. And she can hear you, you know, even though she's on all these drugs that are sedation, she can still hear you. Susan, are you okay? It's done.
You all set?
Oh, yeah.
Are you all right? I know where she's going. See you later. Just undo that, Con. No doubt you're just going to put a little bit of muscle.
Karen, we can probably get the pump out now, eh? Okay. So Karen has to program it. Okay, that's good. So now we're just creating the pocket for the pump, and we're going to place it under the outer layer of fibrous tissue that protects the abdomen. And because she's so thin, the pump will sit very high, and we're just starting to create that pocket now. The pump has to be sitting absolutely perfectly without kinking the catheter, and we have to suture it in place so it can't move. And it has to be absolutely perfect or it won't work. So now we're just injecting the baclofen into the pump, and we're only going to half fill it for the first dose, just so we don't overpressurize it. I think the pump is going to want to kind of sit like that, and we're going to coil it around like that. So in goes the pump, like that. Okay, that's sitting very nicely. This is like the hardest part of the whole operation right here. So there's a point of no return.
Okay, we got to save that piece too, right?
Give me the sleeve. Just give me the handed forceps.
Give your mobile out of the way here. There. Is that better? Is that what you want? Yeah. Okay. You need your hose though. Swear. Oh no. Okay. That's better.
So everything went fine.
So you got the pump in okay?
Yep.
Because she's so skinny and all. But
No, looks good. You're able to get it underneath the wall of the tummy, so that should make it so it doesn't stick out too much for her, but still be easy to fill. It's a bit more painful than just sliding underneath the skin.
Right.
So we're gonna give her some morphine, just for a couple of days. Yeah. Okay. Just make sure she's comfortable.
So she's going to be in some pain then?
Yeah, this is gonna hurt a little bit. And I don't think her back will bother her now, but I think her tummy will be sore for a day or so.
Okay.
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 Okay, you're okay, Shane. It's all right. It's all finished now.
All done, Shannon. Here, sweetheart. Here's
All
Teddy.
finished.
Look, Teddy's here with you.
Take a seat. Okay?
Okay, so what I have to do is I have to find which wire comes out and which wire goes in. Okay, so I'm just going to use this to help me. I can cut it right there. Okay, that one's half done. Okay, now this is the part where I have to take the wire out, okay? So you can tell if she takes big breaths, it really helps it come out, okay? That's it. It's almost done. Okay, here we go. A little more. Okay, Mayo left. There. It's done. It's done. You can wipe your tears.
Would she like a Band-Aid?
Yeah, I think so.
Yeah?
Danisha. I think she's scared. Like she's... Okay, it's okay. There you go. There.
Yes,
Okay.
to cover it, of course. Of course. Yes.
Let's make it all better. You're afraid to look at that, huh?
All better?
Okay, say thank you. Thank you. It's okay. Okay. Mela.
Can you shake my hand?
No,
Okay,
here we
now
go.
we're gonna go. That's the girl. Oh, you're nice and loose up here.
That one's nice and loose. And it's okay, I just want this arm out so we can see what this one's getting there.
Okay. All right, Shannon. Well, listen, I think we're gonna turn you up one more notch, okay?
Turn her up a notch. What
Yeah.
do you think, babe?
So Shannon, I've done very well from the medication, and already I think she's significantly looser, mostly in her upper limbs rather than her legs, but I think her legs are a little bit better.
See?
Yeah.
All right.
So these are all very positive signs, and we're still at a fairly low dose. We're just going up slowly. So once she gets to the Hugh McMillan Center, then they'll continue to increase the dose. They'll just make sure that she gets right back to her full baseline before she goes home. You should be a politician.
Yeah, could make some changes, eh? That's good. Yeah, I think she's doing really good. She's happy because she's not in pain.
Come on in with Susie.
Let's go.
There's basically not much, if any, narrowing left there at all. Occasionally, some of these children will develop a recurrent narrowing, and some of them will develop heart rhythm problems, either from the top or the bottom chamber. But the majority of them, 80 to 85% of them, do well throughout. Okay? Let's have a quick look at her.
Okay.
She seems to be happy when we're listening to her.
Yeah.
And we're all done.
Okay. All done. Can you say thank you?
Know that one, huh?
Yeah.
Susan has now recovered from surgery, and her heart function has improved. She will remain in Toronto for several weeks, so doctors can ensure she continues to do well before she returns home to China.
Wow, all dressed in purple too.
Yeah.
You look great.
Look, show Dr. Failing. Come on, look.
Oh,
Show.
very nice. You're starting to get some relaxation over there too.
Yeah.
Excellent. Shannon, what I'd like to do is I'm going to plug my programmer in here, and I would just like to scan your pump and see what it's reading. Okay. Let's see what it says. It says you've got 8 cc's in your pump. Yeah, your parents are on top of things. 200 mics. They got the right answer.
And we passed.
Other thing we're going to do is we're going to try to get you home as soon as possible. Okay? Because I know that would be nice too.
You want to go home? Feeling good? Hey, feeling good? Yes. All right.
Now that Shannon has a baclofen pump to deliver her medication, her rigidity and spasticity have been greatly reduced.
Down. Sit. Sit. Tell them off. Look at you. You hugged your first hugs. You haven't been able to give hugs before, have you? But now you can. Now all you want is hugs.
She can now enjoy movement without pain, and doctors hope to see even more improvement for Shannon in the future. The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Cameron's cleft lip and Norman faces cancer. Two weeks ago, 12-year-old Norman Russell complained of abdominal pain.
Open wide.
After a series of tests, he was diagnosed with renal cell cancer when doctors discovered a massive tumor on his kidney. Today, Norman will undergo emergency surgery to remove the tumor, along with his right kidney.
Pardon me? So hungry. I know you are. I'm sorry about that.
Doctors suspect the tumor may also be stuck to other vital organs. If doctors cannot surgically remove the entire tumor, Norman may not survive.
And if you've had anything to eat or drink, you could throw up and you'd be sleeping and you wouldn't know it, and that's very dangerous. That's it. So I'll just wait to hear from the OR, probably another hour or so, hour and a half. You should watch a movie until then. You can't think about food.
Every movie has food in it. Do you have one that doesn't have food in it?
I'll look for you.
So we're dealing with a right-sided tumor, and there's those two areas, there's the liver, there's those two areas here that are bothersome. So both in this area and in this area we have question mark whether we'll be able to get this mass out. But it's a very rare tumor for a 12-year-old, there's no question about it. I don't know where he got it from, and it's so large too.
He wants the ride. So you can walk down with him if you want, okay?
Going.
Come here. Yeah.
3-month-old Cameron was born with a cleft lip.
Are you gonna smile today?
Are you gonna smile today?
Cameron's condition was diagnosed in utero, and her parents have been working with the hospital's cleft lip and palate team since she was born. Today, Cameron and her parents will meet with doctors to prepare for surgery to close her cleft lip.
That's good. Hi there. How are you?
Hi, how are you?
Nice to see you again.
Happy New Year.
How's our friend? Well, that nose is really coming a long way. Have you noticed a nice change?
Yeah. Very nice.
Yeah, you've done a great job, yourself and Dr. Vendatelli. Done a great job getting that cleft narrowed and getting the nose straightened.
That's
the
okay,
alveolar
sweet.
arch is really nice and regular.
That's good, girl.
The cleft goes all the way back to involve the soft palate. Great. I'll try and show you what we're planning to do. If you look at a normal lip, we have two columns there, the philtral columns. And on the non-cleft side, it looks normal, it's well formed, but we don't really see it on the cleft side. But that's where we can place our scar so it's less obvious.
That's where the scar will be?
Okay.
It'll be about 1.5 millimeters to 2 millimeters broad, so it won't be big.
Okay. I'm worried about when, after the surgery, they have to bind our arms down. And I know we have to do that for about 3 weeks. And she's going to hate that.
Yeah.
But she loves having her, her hands and her...
Right. Well, exactly. Look at her. That's where she puts her fingers. And we just can't afford that. If she were to disrupt the scar, then disrupt the repair, then we'd be back where we started.
Right.
These are the restraints. They're not that awful. And they just go around the elbow just to prevent
Also, they're
them-
not tied down to her.
No.
Oh, I thought she was going to be in a
Like a little
straight
straight
jacket.
jacket.
That word
Yeah.
restraint.
It's that word, but you
we got to get a different word for this. So she can't bend her elbow.
Okay.
Okay.
Oh, that's all right then.
So do you remember what we explained to you about the surgery? No. Not really. Okay, we'll go through it. So basically, when you'll be asleep, we're going to go inside your abdomen and we're going to remove your kidney. The whole kidney with the tumor itself. Okay? We'll probably go through an incision under your ribs, right here. So this is a surgery where we're gonna go to the big vessels near the vena cava. That's the big vessel bringing back the blood to the heart. And because he has a large tumor, okay, we have to take good care of those vessels, but there's risk of bleeding.
I think we're pretty much ready to go, Norman. So do you now? Yeah, we have to go in now.
You did.
Okay, why don't you shut down Super Mario and you can say bye to Mom and Dad, okay? Dr. Corey will come out and let you know how everything goes. Okay? I'll give you a call after he's off to sleep, okay? And I'll let you know how the induction went. Okay, in the meantime, you try and hang it. Okay? Okay, tell Mom and Dad you'll see them soon. Come on, Dad. This is as far as they go, honey. What? Yeah, this is as far as they go. Are you sure? Yeah, I'm positive. Okay?
I'll be ready for you when you get back. Be strong for me. Alright?
Oh, good.
Just be strong, alright?
Okay. See you in a minute. Okay, darling. Yeah, it's been a bit long.
What are you worried about the most?
It's just that I've never gone through anything like that. Watching my son go through this, it's very hard. The doors are closed, they're locked out.
Yeah.
He's in there, we don't know what's going on. Not that I don't trust you guys.
But is your immediate concern his safety through the operation?
I thought of the operation, going through all those needles, drugs.
Yeah.
Afterwards, pain.
Yeah. And if we come out nice and clean and there's no evidence of spread and there's no lymph node enlargement and there's nothing in there, then there's a very good chance that this will be the end of it.
Yeah, but you're just hoping for that. You have not gone in it. You don't know what's happening down there.
We don't know for... Do we know for sure? No, we don't know for sure, but the statistics are, and the numbers are, give us enough evidence that we sort of should be a bit reassured that he should be fine. And then you're going to say some prayers too, right?
Yeah, we did it.
There you go. We're going to approach this from the front, and the mass will be underneath those ribs right where my hand is. So we need to go into the abdomen and then go up here and mobilize all this and free it up and be able to move it down for him. Knife, please. And we're going to follow his rib cage down to the side. Let's go ahead and open external oblique here. Reinforce it.
He's getting nice and big. Nice round cheeks.
Yeah, chubby cheeks. Hey, sweetie. Alright, there you go. Good girl.
All right, so she's managing well with the plate?
Very well. No problem.
Feeds well with it, and
Excellent.
so the nose is really corrected nicely.
Yeah, it looks really good even without it.
What we wanted to do is with the plate is reduce the cleft, and it's now down to 2 millimeters, so that's wonderful. You see when you put the lips together, that nose and the lips is going to just look wonderful.
Oh, okay.
Yeah. I'll just hold this if you could do the elastics.
There we go.
Wonderful.
All done.
Yay.
All done. Good seeing you again. I'll wish you all the best for surgery, and that'll be it.
Okay, sweet.
There's the liver, and there's the gallbladder, and there's the tumor here. All the way up there, going up below the diaphragm and displacing all the bowel down here. That's where the cancer is. You know, we were worried that it may be stuck to the liver, but it seems to be, at least in the front part, not. But there's an upper extension that's going almost close to the IVC there. That may be stuck in there.
Today's your big day.
Yeah, it's a big day today.
It's okay, honey.
No.
She looks great.
Yeah.
Say hi, Dr.
Okay.
Fisher.
I told her that she's been waiting all her life for this.
Yeah.
Literally.
Exactly. Okay.
See you later.
I'll see you down there.
Yeah.
Okay?
Thanks, Dr.
Thank
Fisher.
you.
Righto.
Okay. I know.
Okay, honey.
It's okay. It's all right. Okay, it's okay. It's gonna take good care of you.
Oh, this is little bit.
See you later.
Got your big toe sticking out. Okay,
Bye-bye,
say
sweetie.
bye-bye. Say bye-bye, mommy.
Okay. All right.
We'll be taking care of them.
Yeah.
Okie doke? Alrighty.
Kidney's now turned all very dark blue because we cut off its blood supply. Now we're going to mobilize it off. It is stuck up there. It's fairly stuck up in the upper part of the tumor there against the liver. That tumor, yeah, that tumor's probably been there for 3-4 years. Okay, Gemini. Cameraman, you ready? Coming, it's coming, it's coming. There's the beast. So tumor is all this, and then the remaining part, which is normal kidney, is down here. Big hard mass. Okay. Everything went beautifully. Yeah. Took the whole kidney out. Was a bit stuck on the top part where I showed you on the X-ray. We were able to go around that area, remove the whole tumor with the upwall very nicely without problems at all. Then I sampled the areas where it was stuck separately, send those off to make sure that they didn't have any tumor in them. Okay? So be optimistic, keep your spirits up.
So can we see him? Not yet?
Just give them a few more minutes. As soon as he's ready in recovery room, they'll call for you.
Okay.
Yeah.
Okay.
But
Hi, it's Mom and Dad.
He's doing fine. He really is. The oxygen, that's just routine until he wakes up. Norman, can you let your mom and dad know that you're okay?
Dad. Hi,
It's
Dad.
still pretty sore.
Can't talk now, right?
Everything's gonna be alright now,
This is a complete cleft. There's a whole spectrum of clefting, from very minor to severe, and this is a complete cleft on one side. And the goal today is really just to repair the lip and to fix the nose a little, and to close the communication between the nose and the mouth, just in the region of the nostril sill. And then this is going to be the opening incision. A little triangle. This little C-flap then is going to come across in there and form that barrier. That's great.
how are you doing, Becca? How are you feeling? Okay? Good. Are you having a lot of pain?
Not right now.
No.
I still don't know what happened to me.
Yeah. Well, what we did when we got in there was a big mass, big lump coming off that kidney. And we were able to very nicely take that out with the kidney. Now, it's going to be very important what we find when the pathologist, who's the doctor that looks at these tumors under the microscope, it'll be important to see what they find in the tumor. Because if the tumor escapes from the kidney into those glands, that makes it a bit different. But if it's all in the kidney and the kidney was taken out, then you may not have anything to worry about.
That's great. So we've closed the nostril sill. Now all we have to do is do some work on the nose. And when we're done, the nostril actually looks narrow because of all the swelling. But I know it's about the same because we've measured it. So, and it recovers, it comes back nicely. So we're almost done. Everything went just fine.
Okay.
Okay. So she's awake from anesthesia.
Okay.
The lip came together nicely. Okay. Got a nice correction of the nose. It's still a little asymmetric.
Okay.
I did put in the nostril stents. It's really hard to get the nostrils perfectly symmetric in a very wide cleft like this one was.
Okay.
Hopefully this and the stent will be enough, but we'll just have to wait and see.
Okay.
Okay?
Okay.
How are you?
Good.
That's good.
It's great.
So brave.
Beautiful. She looks good. She looks so different.
You can sit up. Yes, put your feet up. Sit up. Sit on your butt. Need help?
Yeah.
Put your feet down. Walking in the hallway, okay? Straight. Stand straight. Stand straight.
I can't.
Why can't you?
because
Let me
it's
hold
hard.
this. Yeah, let me take this.
How are you? Yeah? Every time I walk in, you're eating some candy or some snack. Let's have a peek at that tummy of yours. Ow. Hey, somebody drew a line on your tummy, man. What's going on here? Huh? That looks great. You've healed so nice, you can't even tell you have a scar there, huh? Good man. Well, listen, I have good news for you. Yeah. We got the pathology report. It looks very favorable. All right? It's a cancerous tumor, but it's made of cells that are what we call well-defined. Well-defined means that it's well-organized, it's not very cancerous, very malignant type cells. It's the more benign side of cancers. The spread is also good news because the tumor was all localized in the kidney. Whatever we took out that was encapsulating the tumor. There was no tumor that was outside that capsule.
Okay.
So it all came out nice and clean. And also the lymph nodes that we biopsied, all of them came back negative. Not a single tumor cell in there. Okay?
Yeah.
I'm getting a smile now.
That's very good.
Do you understand what I just told Mom?
Partly, yes.
Your tumor looks good. Okay? It looks like it came out all complete and nice and clean. Hopefully, you won't have any problems with this in the future. Very good.
Good news?
Yeah.
Thank you very
All
much.
right.
Thank
Good.
you.
Okay. See, optimism pays.
Yeah, it does.
Right?
Thank you.
Good.
Did any changes to your address or your phone number?
She's good.
Yeah.
Hi.
There's a tendency for the scar to contract with time, and all scars do that. But you can counteract that with the massage.
Okay.
I bet within a couple months, if you're persistent, you're doing it all the time.
Oh, okay.
It'll come down,
Several times.
and it'll that redness will go away.
Oh, okay.
Okay, but she'll always sort of have this dip that sort of dips
I
the
hope
V.
not,
Or
because the
no?
contraction goes all the way around the lip. That's what's causing that little notching.
Oh, I see.
okay.
So it won't
Okay.
always look like that.
Oh, great smile.
Thank you so much.
You're most welcome.
We're so glad to get to this point.
Take care.
Thank you very much.
Happy.
Yeah, great.
Thank you.
We'll see ya.
See you, sweetie.
Good girl. Good girl.
Cameron's cleft lip surgery has been a success.
Up here.
Doctors hope to see even more improvement over the next few months as Cameron continues to heal.
Guys, this way, please. Stop putting these on the table. Here.
Just 3 weeks after surgery, Norman continues to make a remarkable recovery. He will be monitored for a recurrence for several years, but doctors hope that Norman will not have to face cancer again.
I tried that